People, expand your capacities because we are now about to witness of Kerala, Dr. Shri S. Gopakumar sir. The chairpersons for this session will be Dr. Shri Mehta sir and Dr. Shri Mohan Ende sir. I request Dr. Rashmi Kande ma'am to introduce Dr. S. Gopakumar sir to our audience.
Good morning all of you. It is my great pleasure to introduce my guru. I just follow Gopakumar sir as a Eklavya and very pleased here to welcome sir. He is an idol of knowledge and experience and inspiration to all of us. Sir merely requires any introduction. Already sir given a lot of introduction about sir. He is a well-known personality in Ayurveda nationally and internationally. Sir given me biodata of Gopakumar sir. It is of 20 pages. It is not all awards or presentations of sir. But yes, surely sir. Yes, sir. This thought is also in my mind. Maybe sir may publish a book on this. Major awards are Acharya Award, and he is the best Ayurveda teacher by CCRAS, and it is the first award by Ayush for best teacher. He publishes almost 78 papers nationally, internationally. Awards are mostly 20 to 28 awards, and most important I want to express here that he presented a paper on integrated holistic health care at House of Commons, British Parliament on International Yoga Day on 21st June at London. He is the first person who honored by the British government. Sir has published so many books. Today I want to especially mention about the Sparsh. It is a very nice book written by sir. And he is poet also. Written a very nice poem in that book about skin. I have read that book I think every day. Every day I go through that best book of sir. He is very socially active also. Taking programs from school-going children to Ayurveda professionals. So I request sir to fulfill our knowledge with your all precious thoughts. Please welcome.
I would request Dr. Ravi Putin Sultana sir to accompany sir to the stage. Welcome sir.
महत्वाचं काय आता when anything is unavoidable मला ऐकायला नाही आलं केशर मेंबर कडून when anything is unavoidable now we are going to see a very brilliant session. त्यामुळे या छोट्या छोट्या गोष्टी आपण करतोय व्यवस्थित. तर आपण सेशनला सुरुवात करूया आणि त्यानंतर आपण एन्जॉय करत करत प्रॉब्लेम सुटलेला पण कळणार नाही आपल्याला. ओके, आर यू रेडी? हाऊ टू जोश? नॉट सो हाय. हाऊ टू जोश? So now I would like to invite Dr. Gopakumar sir to start his session.
Good morning. Good morning. There should not be any Srodha when we discuss Ayurveda. Am I right? Yes. So I will be jumping here. I will be going through all the Srodhasas, but there is no Vimargamana for me out. And I will never allow you to have a Vimargamana before 1 o'clock. Ready? Yes, sir. Yes or no? Yes, sir. Okay, so from this moment onwards, we will be having a scientific journey through the Ayurvedic dermatology and trichology. First of all, I am very much thankful to Dr. Harish sir and his entire family for giving me such an opportunity. And I'm very much thankful to the chairperson, Dr. Mohanande, and all the guests on the stage. Ranade sir, my dear brother, my classmates, Sham doctor, everybody. So without wasting any minute, any second, let us go to the journey of Ayurveda. Ahara Sambhavam Vastu Rogascha Ahara Sambhava. I think you very well know this quote. Ahara Sambhavam Vastu, the entire body, each and every biologically active cell in the body is derived from the food you eat. So basically, any challenge coming to the skin, any challenge coming to the hair will be basically from the internal environment that is due to the food, and next thing will be the external challenging factors. So you have to always think about your ahara vihara to control your skin disease. And this is the topic for the day, Ayurvedic clinical approach to skin and hair disease. I will be giving equal importance to the management of skin diseases as well as hair diseases using classical clinical Ayurveda. I underline the word classical clinical Ayurveda. The presentation will be having 3 parts: the diagnosis and investigations of skin disease, management protocol divided into 2, that is skin and hair. Okay, before we enter into the topic, I would like to make some basic understanding regarding the modern dermatology. Even though when I was a student in Trivandrum Ayurveda College, any skin disease coming to a patient will be primarily considered as Rakta Dushti. Because according to Ayurveda, the entire Kushta spectrum of disorders are included under Raktavha Dushti only. But we very well know each disease is different. When you are getting an eczema, when you are getting a seborrheic eczema, and when you are getting a psoriasis, all the 3 will be having the basic involvement of Raktavha Sarodhas. But to treat them in the practical sense, you need a very detailed clinical understanding. So I will always tell you, there are 2 things to be considered in your mind. You should be always able to identify what is the exact primary and secondary lesion in terms of modern dermatology. I would never tell you that modern dermatology is must, but if you understand the modern dermatology in a better way, that will definitely help your Ayurvedic understanding. So my humble aim is to tell you something about the basic pathology in modern medicine. Before that, these are the area, my dear friends, you have to explore if you really want to make a successful story in your skin practice. You have to definitely read the Kushta spectrum, the Visarpa spectrum of disease, the Vidravi spectrum, the Visvoda, the Shitra, the Shudra Roga, Shita Vitta, Udarda Koda, Shiro Roga, Kaladi, etc. These are the major areas where you have to travel with the greatest care to get the most needed knowledge in Ayurvedic dermatology. And etiology of skin diseases and hair, it is very simple. According to modern, you have infection, inflammation, climate and physical factors, allergic responses, autoimmune conditions, metabolic diseases, malignancy, stress, and even heredity. So almost all the Nija and Agandu pathologies are very well maintained under the clinical umbrella of pathology. So some of these etiological factors may work either single or in combination to cause a particular skin disease. So all these factors are very much important. Okay. Now this is a very famous concept we use in Kerala. Not only in Kerala, everywhere, but very much we practice in our daily practice the concept of Dushi Visha. I think I will tell you one important thing. When we practice Ayurvedic dermatology, we give a prime importance to Agata Tantra principle. Agata Tantra is a branch where we deal with the toxicology. Apart from the Agandu Visha like cobra poison, insect bite, there are so many Stavara Visha concept in Ayurveda. Ayurveda mentions about Stavara Visha, the entire Visha which you are getting in the contemporary lifestyle due to pollution, plastic, pesticides, chemical, radio injury, everything is coming under Dushi Visha. I am telling you the concept of Dushi Visha. Prakvadajirna Shidabhra Diva Sopna Ahitashane Dushtam Dushede Dadu Nado Dushi Visham Spradam. You will not believe me if I am not telling the example. There is a famous yoga in Ashtanga Hridayam Agadadandra Pratikarana, that is Dushi Vishari Guliga. I am telling you the yoga, this is available. This yoga, whatever yogas I am telling are available yogas in the market only. Please pay attention. Dushi Vishari Guliga is mentioned for the management of all slow poison. The word poison here means all the artificial coloring agents, the artificial preservatives, whatever we eat as junk food, etc., the preservating, the coloring agents, the aromatic substances which are having a slow harmful effect in the body are called Dushi Visha. I will tell you the yoga. Pippalyo Dhyamagam Mamsi Lodra Mela Sujarchiga Udannadam Nadam Kushtam Esti Chandana Gairigam. All the drugs are Pitta Shamana, Shida Virya, Rekta Prasadana drug. I will tell once again. Pippalyo Dhyamagam Mamsi. I will give you this PowerPoint, don't worry. When you write, no, you cannot listen me. So never write. Nobody has become an expert in CME by writing. Why you are writing in the paper? Because you never respect your Manovaha Srodhas. Paper is a Ajedana Drivya. Your mind is Chedana Drivya. Write in the Chedana paper. Okay. So what I am telling is always, whenever we are giving 1 minute to listen the word, automatically it will come. Okay, there was no PowerPoint when Atraya taught Agnivesha. No Pela learned anything from a CMA. Okay, so forget it. So I will be telling you, Pippalyo Dhyamagam Mamsi Lodra. A very potent drug is Lodra. Ela, Sujarchiga, Udannadam, Nadam, Kushtam, Kushta, Nada, Tagada. Both are very much important. Esti Madhu, Glycyrrhiza glabra, Chandanam, and Gairigam. Gairigam is one of the mineral drug. All these drugs are indicated for the management. And you see the last word in the yoga, Dushi Visharir Namnayam Naja Anyatrabi Varyate. What is the meaning? I am telling you one yoga in Visha, but it is not contraindicated in other conditions also. You know, in Kerala there was an episode of endosulfan related tragedy. You know what is the word endosulfan? Any of you know? What is endosulfan, madam? So it's a pesticide which was sprayed in the cashew plantation, and due to the impact of this pesticide in northern Karnataka and northern Kerala, that much number of children developed neurological developmental disorder, neuromuscular degenerative diseases. Even the next generations are also getting the birth with deformity. So that was the harmful event. In such a condition, the drug selected for further clinical study was Dushi Vishari Guliga. So after that primary experiment, that Dushi Vishari Guliga was declared as a medicine and it is officially manufactured. So my point is very simple. Before treating any skin disease of allergy, that is the point, I am coming to the clinical point. Before treating any skin disease of allergy or any skin disease where you are getting the involvement of such external factors, give the importance to the factor Dushi Visha, and Dushi Visha leads to Agni Dushti, Dhatu Dushti at various level. My dear friends, Rasa Dhatu is very much importable for skin's health, because when Acharya Charaka is telling about this Sara, you know Sara, Ashta Saras are mentioned. Are you following me? Yes or no? Okay, so Acharya is telling about 8 Sara. What do you mean by Sara? Sara represents the tissue vitality. The vitality, the essence of each tissue is called Sara, and according to Ayurveda, there are 8 Sara. The primary Sara is not Rasa Sara, it is Tok Sara. So I am telling you, Acharya never used the word Rasa Sara, but he used the word Tok Sara. That itself tell you that Rasa Dhatu Shuddhi will be directly manifested in the skin. Your skin health and hair health is directly proportional to the Shuddhi, purity of your Rasa Dhatu, because Rasa Dhatu does the wonderful function of Prenanam. Are you getting me? During my presentation, I will be telling all classical word if you are interested. Otherwise, I will tell you the disease and medicine. Whichever you want, you can tell me. Huh? Huh? Okay, so that is why otherwise you will tell, sir, already we studied everything in first year. We escaped from first year and again you are teaching the first year. Okay. Do you feel like that? Okay. So I always love to sit in first BAMS only. Why? Nobody will ask questions because first BAMS student is a humble student. Okay. So the Rasa Dhatu, I am repeating the word, the purity of the Rasa Dhatu is highly essential to get the desired physiology of the skin. And the next Dhatu is Rekta Dhatu. So I am telling you, the combination of Rasa plus Rekta is absolutely needed for the skin health. And what is the link for Rasa? Kapha dosha. What is the link for Rekta? It is the Pitta dosha. So I will tell you, Kapha, Pitta, Prakopa, Ahara, Viharas will be definitely having an impact in the skin health because it will affect Rasa plus Rekta. Clear? Yes or no? The concept is clear. I never want to create further Ajirna in your skin, Manovaha Srodhas. I am here to make some possible ama padana only. So think about kava prasadana, pitta prasadana by vamana virejana. Vamana is kava prasadana in nature. Virejana is pitta prasadana, and when kava prasada, automatically rasadadu will become pure, then twaksara will be normal. All the filamenters are having pravara twaksarada. You know, Aishwarya Rai, Abhishek Bachchan, all are having pravara twaksarada only. So Dushi Visha will definitely be considered as an etiological agent. Now coming to the next point, Rekta Dushti versus inflammation. I have to tell something which will connect the link between both pathology, vascular and cellular events of inflammation. My dear friends, when there is inflammation, it is called Paga in Ayurveda, inflammation, and Paga plus Shodha will be having vascular and cellular events. When you are talking about a dermatitis, when you are talking about any infective episode of allergic pathology, there will be problem with cellular level and vascular level. The permeability across the blood vessel will increase, leading to edema. There will be problem in the WBC and other cells, so there will be multiple events, and all these events are directly linked with Rekta Dushti only. So I am telling you the each and every word, the transient vasoconstriction, persistent progressive vasodilatation, increased local hydrostatic pressure, stasis of circulation. This is very important. Whenever you are applying Jaluga or Rektamoksha, Prachana, etc., you are removing the stasis of circulation. The word stasis of circulation is nothing other than Sangha in Rektavaha Srodhas. I am repeating the word Sangha. Whenever there is a Rektavaha Srodho Rodha, you are getting all ischemia, infection, and all discoloration. So when you keep the Jaluga there, when you keep the leech there, when you do the Rekta Mochana, you are removing the Sangha only. So the word Sangha in classical Ayurveda is very much related with the stagnation of the circulation and finally leukocyte margination. I will tell you, without causing Agni Shuddhi, without causing Pitta Shuddhi, there is no treatment to Rekta. So when I am asked to treat a case of skin disease with infection, I will always go to the Sharat Irducharya. You know what is Sharat Irducharya? You may ask, what is the role of Irducharya in skin health? I will tell you, Sharat is the Irdu where Pitta Prakopa is occurring. And in Sharat Irdu, Ayurveda very well told, Tajjayaya Gridam Tiktam Virego Rekta Mokshanam. Tiktaka Grida will be given as Snehapana. Follow me carefully. Tiktaka Grida will be given as Snehapana, followed by Shodhana by Abhibhatti Churna, followed by Tiktaka Grida internally as Shamana, plus external lebanas which will be having Pitta Rekta Shuddhi. This is the management protocol classically for a Pitta related skin disease with but there will be a difference of color. Most of the time it is very much similar to the Kodha mentioned in Ayurveda. I am telling you, the macule is the primary pathology. See the next one. Papule, small solid elevation of the skin less than 0.5 centimeter in diameter. First time you are getting, there is an elevation. So what is the link? From the macule to papule, there is an elevation, and without Guru Guna, Sthira Guna, there is no question of elevation. So from the macule to the papule, there is kapha. Are you getting me? Whenever you are getting a raised skin lesion, there should be Guru Guna. There should be Sthira Guna. Without Guru and Sthira, there is no question of any raised lesion. So you see, in the macule you are getting Rekta Dushti, but in the papule you are getting Rekta plus. Excellent. Rekta plus. So this is the Amshamsa Kalpana in Ayurveda. I am telling you, you never go directly, go by systematic understanding. Doshanam, Samavedanam, Vigalpo, Amsha Kalpana. What is the quantity of distribution of each property of each dosha in a particular pathology? That mathematical calculation is called Amsha Kalpana. That itself is called Vigalpa Samprapti. So please pay attention what is macule and what is papule. And then you can see you are getting nodule. See, when you come to the nodule, it is again becoming hard. So kapha, snigdha, and some rutshada or the vada will come, it will become hard, then you are getting the nodule. A solid mass in the skin, usually greater than 0.5 centimeter in diameter, situated deeper than papule. So when you get a nodule, you cannot treat by a lepana. When you are getting a papule, you can treat by a lepana because nodule is harder. due to the Ruksha Parushaguna Vada, you need Chara. Are you getting me? So macule is Rekta Dushti, ordinary Pittasamana Leba, Jadamaya the Leba, Chandana the Leba, enough. When you come to the little bit papule, you need Kapasamana, Eladi Churnam is good. Eladi Churna mixed with coconut milk or even mixed with takra is effective in the kapha dominant papule. But when you are getting a nodule which is still harder due to the Ruksha Parushaguna, you need a chara, application of Kalyanaka chara externally. Are you getting me? So the point is, each primary lesion as per modern pathology can be explained using Ayurvedic Vikalpa Samprapti, then selecting appropriate Ayurvedic treatment. That is my point. Is it clear? Will be converted into a minimum size. So Varanadi Kashayam plus Kandanara Gugul is an effective practical yoga, and that is what is happening in Vidradi abscess. Okay. Now coming to the vesicle, you can see again you are getting kapha. Again fluid filled kapha is present. Circumscribed elevation of the skin less than 0.5 centimeter of diameter and containing fluid. We can call it as vispodam. Ayurveda mentions about, the chicken pox early lesions are always having the vispoda. It is again Vada Kapaja. And Bulla, circumscribed elevation of the skin over 5.5 centimeter and it contains fluid. Again, it is again more kapha dominant. So vispodam in different sizes are mentioned as vesicle and bulla. Okay. Then next is wheel. An elevated white compressed enhanced area produced by dermal edema. This is typically occurring in Udardam, Shidabittam, Kodam, Arctic area. The hypersensitivity Arctic area condition, you are getting dermal edema. All the preparations will be having Nimba plus Rajani. Nimba plus Haridra having very good antihistamine action will be seen in the conditions of Arctic area. The word Arctic area in modern medicine is nothing other than Shidapittam, Udardam, Kodham. Ayurveda mentions about 3 hypersensitivity disease. Remember, Ayurveda mentions 3 hypersensitivity disease. All the 3 are allergic, and Vada dominant is Shitapitta, Pitta dominant is Kodham, and Kapha dominant is Udardam. Don't forget, all the 3 are hypersensitivity reaction where I prescribe Padoladi Kashayam, Nimbarajanyadi Guliga, Rajanyadi Churnam, Haridra Kandam, anything which contain Padola, Nimba, Haridra. I repeat, Padola, Nimba, Haridra are very well proven drugs in the conditions like Arctic area. And again you are getting Petachia, pinhead sized macules of blood in the skin. These are, you can see the pinhead macules in the skin where we always prescribe Rekta Pitta Hara Chikilsa. Rekta Pitta Hara Chikilsa, the best practical yoga which I am giving is Vasha Guduchyadi. Vasha Guduchyadi is a potent yoga indicated in inflammatory conditions of Petachia. What is Vasha Guduchyadi? Vasha Guduji Tripala, Kaddi Bhunimba Nimbaja, Koda Shavdra Ido Handi, Pandu Pittastra Kamala. Vasha everybody know. Guduji everybody know. Vasha Guduji. Tripala everybody know. Kaddi means Kadurohini. And Bhunimba Nimba. All the drugs are the combined effect. They are having very good action in the pinpoint hemorrhagic spots called Petachia. So my point is very simple. I am telling you the medicines for skin disease not only from Kushta but also from other diseases like Pandu, Rektapitta, etc. Because Rekta Dushti is universally present in most of the skin conditions. So that is about the primary lesion. Now I will summarize everything in a single picture. Please pay attention. Please pay attention. See, this is the cyst where you can see kapha domination. Are you getting me? Kapha, why kapha? Because Tiraguna, Guruguna is there. You are getting a fissure means a crack where there is Vada. Without Vada, there is no crack. The kapha component in the skin, when it is becoming less, automatically cracks will develop. We call it as Vipadika. So the word is very important. Normally, kapha is having the oil nature in the skin. When the oil nature of the skin is reduced by snigdha kshaya, rukshavriddhi, vada prakopa, you will be getting vipadika fissure. So I am teaching you how to apply Ayurvedic Vikalpa Samprapti in modern dermatological complaint. So this is fissure. And again you can see the macule. Polyp is exactly like a kapha domination. We will keep with Chara. when you are getting such skin tags, we apply Leshuna plus Shigru plus Sarshaba as a paste. I am telling you, all the three are Tishna, Ushna. Leshuna plus Shigru plus Sarshaba, all the three are Tishna. We will make a paste and that will be applied around the stalk. After 3-4 days, it will become Mrudu and shed off. And one more treatment I am doing, I will take a Leshuna Kalka, garlic paste, and Shigru Mula paste. Both will be converted into a small potali, and that potali will be rubbed over the lesion like what? It will be becoming slow and finally shedding off. So, Tishna, Ushna properties of Shigru, Lesuna, etc. are applied in the management of polyp. Then papule is almost same. Nodule need Charaguna or Lebana by Tishna Dravya, and pustule you need always see the Vidyadhara, Chandanadi Kashayam, Chandanadi Lebam, Jadamayadi. Vesicle need always Kapashamanam, Eladi Churnam, Surasadi Churnam, Arkadi Churnam, like that only. So my point is very simple. Identify the lesion as per modern pathology, understand the Ayurvedic guna, so you will be treating. So I can tell you very simply, a nodule is treated by Eladi Churna externally. A polyp is treated by Lesuna, Shigru, Sarshaba Leba externally. A vesicle is treated by Kabashamana, Arkadigana, Aragodadigana, Lebana, Parishega externally. So whatever be the modern primary lesion, identify the guna of dosha in Ayurveda. Whether it is Ruksha Guna Janida, crack. Sida Guna Janida, stagnation. Ushna Guna Janida, inflammation. This is the point of application of Ayurvedic Samprapti according to classical Ayurveda. Then you will be getting enough number of yogas. Never think that there is a yoga mentioned for Sisthihara Yogam, Fisher-Hara Yogam. No. You always think about Snigdha, Guna, Janida, Kapha leads to oily skin. Opposite to Snigdha is Rucha. Rucha means Churna. Churna means Kola Kulatadi Churna. Do the powder massage. So, Kola Kulatadi Churna using as the powder massage, Sarshaba Churna using as the powder massage, Yava Churna using as the powder massage is effective in the management of oily related kapha dominant conditions. So, this should be your approach. That is why I am telling in the beginning. Okay. Now, coming into the secondary skin lesion, you are getting secondary skin lesion. It will be scale crust ulcer. Most of the skin diseases, if you don't treat properly, they will go to the secondary lesion where you are getting scale, a flake rising from the horny layer. Typical example is psoriasis, psoriatic scale. And crust looks like a scale, but it is composed of dried blood or tissue fluid. You need chalana. Chalana means washing with Kashaya Rasa property. The best chalana drugs in current practice, in my opinion, is Panchavalka Kashayam. You know Panchavalka Kashayam, I think you are familiar. And Chiri Vrshatto Kashayam, Shigru Mulatto Kashayam, Tripalatto Kashayam, Arkadi Gana Kashayam, Surasadi Gana Kashayam. These are the yogas which can be converted into decoction, Kashayam, which can be used for either Parishega or Dhara against such conditions. So, crust. And finally, ulcer, an area of skin from which the whole of epidermis and upper part of the dermis have been lost. We always treat with the Jatyadi Gridam. You know Jatyadi Gridam is mentioned in Vrana Chikilsa, Dushta Vrana Chikilsa, which is having a unique property, Shuddhyandi Rohandicha. Some yogas will do Vrana Ropana, healing. Some yogas will do Vrana purification. But Jatyadi will do 2 in 1, Shuddhyandi Rohandicha. So that is very important. So identify the secondary lesions in the skin pathology, then you will be getting good result. See the scale, you are getting scale, crust you are getting in the middle, and ulcer. You know, this is a typical ulcer developing in diabetes patient. Typical ulcer developing in diabetic patient, we always treat with the Sahajaradi Kashayam. You know, Sahajaradi Kashayam is indicated in Adakaya Vada. Sakajaram, Suradaru, Nagaram. Only 3 drugs are there. Sakajaram, Suradaru, Nagaram, Kodina Mampasti Taila Vimistradam, Pavana Pidida Dehagadi Pravibed, Druda Vilambida Go Bhavedichaya. In my opinion, a varicosity, diabetic ulcer, varicose edema, or even other conditions of deep vein thrombosis, we always give Sakajaradi Kashayam internally. Kaishora Gugulu will be given, we will be supported with the Kashaya, and we will be given internally Madhu Yashtyadi Thailam. You know, Madhyashthyadi Tailam is a yoga which is mentioned in Raktavrta Vada. You know, Raktavrta Vada is representing the ischemic pathologies of the lower limb. You go to the Raktavrta Vada Chikilsa, a beautiful concept. The problem is we never read all these basic concepts. I am telling for your further reading, Raktavrdesa Daharti Tungmam Sandaraja Prasham Bhavecha Ragi Shoidu Jayande Mandala Nicha. Once you read these two lines, automatically the entire varicosity spectrum will come to the minds. But we always read only modern varicosity and searching for Ayurvedic medicine. Gopakumar will tell varicosity, Madhyashthyadi Dailam. Who told? What is the link? But when you read Raktavrta Vada, understand varicosity, then go to Madhyashthyadi Dailam, you will get a better picture. My humble left ventricular request is read Ayurvedic Samprapti. Are you getting me? My left ventricular, you know why I am always telling the word left ventricular request is read Ayurvedic Samprapti, then know everything about modern. Now we know all the modern things. But when you apply the Ayurveda in that, then only you will feel that your prescription is the right person to attack the disease. You know, when I am understanding the Ayurvedic pathology in the modern patient sitting in front of me, and when then I write Madhyashthyadi Yogam, my hasta will get a gurutvam. I call it as hasta gurutvam. Hasta gurutvam samyak preskrusha lakshanam. That is my slogan. No, I am not joking. So that is why I feel that I am going in the right way. Otherwise, who will tell? No, in the OPD, you are sitting in front of the patient. Patient is with all report. Who will guide you that you are right? No guru there. The only guru available is the patient. All the time, patients are the real gurus only. So, I am telling you, Madhyashthyadi Tailam internally, Sagajaradi Kashayam internally, Kaishora Guggulu can be given in all the conditions of ulceration developing in diabetes. One more example I will tell you, Guggulu Panchabala Churnam. You know, there is a yoga called, please pay attention, Guggulu Panchabala Churnam. This yoga is indicated in Nadi Vrana. Have you heard about the terminology Nadi Vrana? What is Nadi Vrana? Nadi Vrana is just like a sinus. Externally, there will not be any opening. It will go with the internal pus formation, and we call it as Nadi Vrana, sinus. And the best yoga mentioned and utilized is Guggulu Panchabala Churnam. I used to tell the available antibiotic drug in Ayurveda without any rasa medicine is Guggulu Panchabala Churnam. I am not a rasa medicine using practitioner. I use mainly herbal medicine, and the yoga is Guggulu Panchabalam Paligamsha Magadiga Jatrpalaja Pradaksya Tuktudi Kasha Yudamadulidam Kushta Bagandada Gunmagadikram. That is the yoga. When my students are sitting for and playing for movies, no, I will write this logo to them. After coming the movie, this logo should be by hearted. When they are watching Bahubali, in between they will learn this also. So they will see Anushka Shetty and Guggulu Panchabala Churnam. I am not joking. So I will tell you the yoga. This yoga is mentioned in Nadi Varna Chikilsa, Guggulu Panchabalam Paligamsha, Magadigaja Tripalaja Pradaksya, Tuktudi Kasha Yudamadulidam, Kushta Pagandara Gunma Gedikinam. The main yoga is Magadiga, Tippali, Guggulu and Tripala Ela. Excellent drug against infection. Recently I visited Melbourne in Australia for a conference. One of my friend who was with me in the conference suddenly developed ear pain. Somewhat similar to the otitis media, ear pain was there. There was no drug available in the ready-made condition. So I told him, are you having Guggulu Panchabala Churnam? He was shocked. Already he is having Karna Shula. He is asking something against the Karna. Guggulu Panchabala Churnam. Then he told, it is there. Then I told, don't worry, you bring your kerchief. Okay, then what is the need of kerchief? He don't know. He took the kerchief and sprinkled the Guggulu Panchabala Churnam, made into a varti. You know varti means varti, and dipped in the ghee, and I have made a funnel with a simple paper and introduced it, and the fume was given to him. And he was simply obeying what I am telling. Okay, because he is having that much of pain only. And after 3-4 minutes, he became very, very confident with less pain, and now he is the propagator of Guggulu Panchabala Churnam with Karnashula. I left Melbourne from the Shaga back to Costa, Kerala, but still that Guggulu Panchabala. So I am telling you, the best you believe from me. Money back guarantee. I am giving my number 9447361304. My number. You can call me. Any infective acute episode, think about Gugulu Panchabala Churna, read Ashtangradayam, Bhagandara, Gulma, Nadivarna Pradesheda, excellent drugs are there. So my point is, use the drugs logically. Ayurveda is never a magical science. Ayurveda is a logical science. Ayurveda, I am not a magician, but I have a confidence that I have a logic of Ayurveda. That is why, Scalpis, the time is up, okay? So many things are there. I don't think that I can finish even by the sunset today, okay? Don't worry. So the next stage is lichenification. So lichenification is a pathology where you can see Geja Charmam, Hasti Kushtam, like that only. We can see this is a condition in which the skin becomes thickened and the skin markings become unduly prominent. The skin markings will become more prominent, and in such a condition, there is hypervada. My dear friends, listen carefully. Ruchaguna plus means dryness. Listen carefully. I am teaching you mathematics and Kushta. There is mathematics in Kushta. Okay. Rucha plus means dryness. Understanding? Rusha plus means dryness. Rusha plus means dryness plus scaling. Rusha triple plus means you are getting fissure. Are you getting me? Yeah. Rucha guna minimum dryness. Rusha guna plus, it is parushada, you will be getting dryness plus scaling, psoriasis. And when Rusha guna becomes extremely triple, Vibhadika and such a pathology where you are getting hyperkeratinization. We call it as lichenification. Apply Mahasneha. What is Mahasneha? Listen carefully. This is not a sneha created by one Mahan. No. What do you mean by Mahasneha? The combination of all the four sneha. Sarpur, Majja, Vasa, Tailam. Dear, listen carefully. When you combine together Sarpur, Majja, Vasa, Tailam, that is an excellent yoga against the cracks. So available yoga in the market is Mahasneham. One more yoga available, that is called Jivandyadi Yamagam. Jivandyadi Yamagam is a potent yoga which can be given in lichenification condition. Those who are only seeing me through the mobile, listen with your hearts. When you are giving the mobile, no, focusing me, you will think that the mobile will learn everything. No, mobile will forget. You listen me only. Okay. I am simply telling, don't worry. Okay. Now coming to the, because I have done all these things when I was a listener. Okay. So then coming to the next stage is very important. I want to change your mind. I want to change your attitude. See, evaluation of skin diseases in Ayurveda is a particular format is there. Identification of the involved dosha, very important. Whatever be the modern diagnosis, whatever be the modern pathology, you identify which dosha is dominant. I am telling you, no skin disease is ega doshaja. No skin disease is ega doshaja. There will be the involvement of more than 2 dosha in any skin disease. You will never get a pakka vada, pakka pitta, pakka kapha. It will be either vada pitta, vada kapha, kapha pitta. Then identification of the gunas involved dosha. What is the meaning? Listen carefully. I want to change you. Rucha guna janida vata will lead to dryness, scaling and roughness. Ushna guna janida pitta will lead to raga, daha, paga, shula, red, kala, rubor, pallor, dolor, inflammation. You getting me? You need a replay. I think sir need a replay. I understood. I am a very good mind reader. See, there's a famous loga in Ashtangradayam Sutrasanam in the 2nd chapter. When you are talking, Janasya Ashaya Malashya Yo Yatha Paridushyadi Tam Tathaiva Anuvarteda Pararadhana Pandita. You know the meaning? Janasya Ashaya Malashya. Once you are talking in a stage, you identify what is in the mind of the listener and talk for them. Never talk for Gopakumar, talk for the audience only. In every CME, there are 3 dukkhas. You know? In the life, there are 3 dukkha. No? Adhyatmikam, Adi Bhaudikam, Adi Devigam. Everybody, Sindagi mein 3 dukh hota hai. Adhyatmikam, Adi Devigam, Adi Bhaudikam. CME mein 3 dukh hota hai. Organizers dukkham, speakers dukkham, listeners dukkham. Are you getting me? So, Trivida dukkha shanti moksham. So I know the pain. So I am telling you, I am telling you very simply. Listen, Rucha guna in skin will lead to dryness, scaling, fissure, crack. Clear? Rucha guna in skin will lead to dryness, scaling, fissure, crack. Ushna guna in skin will lead to Daha, Raga, Paga. Redness, temperature and inflammation. Snigdha guna in skin will lead to oily and discharge. When you are getting discharge with the temperature, pitta kapham. Getting me? When you are getting itching with the discharge, kapham. When you are getting red coloration with the itching, kapha pittam. This is the mode of Ayurvedic evaluation. Then automatically hundreds of Kavavitta yoga will come. There is no scarcity regarding drugs in Ayurveda. Scarcity is only for Yukti in Ayurveda. You open every chapter, there are more than 1,000 yogas are there. To which condition this yoga should be given, that is the logic, that is the Yukti for which you need the guna, which led to the dosha pragopa, then identify that. I will give ample example, then you will understand. Then identification of the involved dusha, whether it is vada in rasa, vada in rekta, vada in majja, vada pitta in rekta, that is the dusha. And finally, identification of other disease, whether it is a prameha-janya skin disease, whether it is an infection related, whether it is a metabolic disease, whether it is an autoimmune disease, all these things are also important. Okay, now I will teach you, this is the best 3 slides I have to share with you. A vata in skin disease, how you will identify? Dryness of the skin, crackles and fissures in the skin, scaling of the skin, roughness and hardness of the skin, painful condition, blackish discoloration. The same thing is applicable to hair. A brittle hair, dry hair, Spudida, Dusara, Kesham. That is a typical word in Ayurveda. Spudida, Dusara, Kesham. The brittle hair, the dry hair, and the hair which is having a very weak hair root, all are Vatika in nature. Clear? In Vada related condition, always start the treatment with the Snigdha, but never jump into oil. Never ever jump into oil, because if you are straight away going to the Taila Kalpana, there can be an aggravation of the further Srodoroda. Brimhyastu mrudu lankayet. Are you getting me? Whatever be the disease of Vada, ultimate treatment of Vata is Brahmana. The treatment of Vada will be always nourishing with the oil, but never apply oil straight away. It will fill the srodasas, it will always make the block. So do Uddhartana. I will tell you, you are having a brittle hair. You are having a dry skin, both are Vada. Brittle hair, dry skin, both are Vada. Vada means Rucha, opposite is Snigdha. You need Taila, but don't jump straight away. You can make mrudu lebana, mrudu uddhartana, mrudu powder massage to keep the follicles open. Then go for the Taila with Pringamalagadi, Nili Bringadi, Kundalagandhyadi, Kayunyadi, whatever you are prescribing. My point is very simple. Vadiga hair disease will appear as dry, weak, brittle hair. Apply mrudu lengana, then only go for the Brahmana. Classical principle I am telling, never start Brahmana straight away. How you are painting the wall? How you are painting the wall? What you will do? You will straight away paint. No, you will remove all the scrap, whatever is, then only you will apply the high quality emulsion. So emulsion is the Snigdha Kalpana, scrapping is the Lankana. Brimhyastu Mrudu Lang. Universal principle in Ayurveda. Brimhyastu Mrudu Langayet. Never attempt Snigdha Chikitsa without having a Lankana Chikitsa. So keep this picture in your mind. This is a drought affected area. You know, in North India, South India, everywhere when there is drought, it will be the condition. This will be the condition in the skin also. We call it as Vibhadiga, Ekakushta, Kidibakushta, same only. So this is the Vadiga skin disease as per Ayurveda. And how you will identify Pitta? You know, reddish discoloration, maculopapular lesion, burning pain, bloody pus discharge, local temperature. Typically, these are the condition of the Pitta. You can see maculopapular lesion, burning pain, bloody pus discharge, and local temperature. Typically, you know Ushna Tishna Guna. All these properties are due to vasoconstriction and leukocyte margination. This is what is called Pitta Rekta, Ushna Tishna Vigalpa. Think about Shida Virya, Nalpamaradi Kashaya Dhara, Panjavalka Dhara, Tripala Kashaya Dhara, Jadamaya Dileba, Chandana Dileba, and finally Pinna Daila, Chijivushta Taila, etc. Everything will be always Shita Guna only. So identify the property by which the dosha vitiated, then treat accordingly. And what is the treatment? You will get a hair, which will be red in color, the coppery colored hair. Ayurveda very well tell Pitta Prakriti people will be having all the Tamra Kesha and Tamra Kesha etc. will be having all Pitta property, and whenever Pitta, that is the number one enemy to hair. You know what is the link between Pitta and Kapha will give strength to the hair follicle and Pitta will take it out. There is a wonderful concept in Ayurveda. Levana Rasa Atyupayoga is the primary reason for hair fall. You know, Acharya told only about one rasa, Kalavi, Palavi. The both the words in Ayurveda are excellent. You know, I was very much surprised by the philosophical thought of Ayurveda. Actually, Ayurveda is filled with the science and philosophy in equal proportion. A philosophical science and a scientific philosophy. And then he is telling, Krodha Shoga Krida Shariroshma Shirogada Keshansa Dosha Pajadi Palidam Sambhavatyadam. See the beauty, how you are getting white hair. The question asked by the Shishya to the Guru, how I am getting premature graying or white hair. Then Acharya is telling, see the logic how he is telling, Krodha Shoga Krida, when you are getting emotionally upset. The stress, that is the word current. The Krodha Shoga Krida Shariroshma Shirogada. When you are having emotional upset, etc., the body temperature will come to head. I am not telling, I am quoting Vagbada. Shariroshma Shirogada, then Keshansa Dosha Pajadi. Hair, it will do the Padana. The hair will be converted into Paga. Keshansa Dosha Pajadi Palidam Sambhavatyadam. Then you are getting white. So what is the logic? Pitta Prakopa in the hair will lead to premature depigmentation and you are getting whitening the hair. Praboundarigadi Keram. I think you know the drug. Heard about it? It is available. Praboundarigadi Keram is an excellent yoga which we give against premature graying, supported by Narasimha Rasayanam. I think that also available. Do you know all these drugs? Narasimha Rasayanam is a wonderful yoga indicated in premature graying of hair externally, Praboundarigadi Keram, and always I suggest Panjadittaga Kshirapagam. Listen carefully. I am telling with the guarantee, Panjatiktaka Kshirapagam internally, excellent drug against premature graying. Because why Panjatittakam, sir? Why Panjatittakam? All the drugs are Pitta Samana. Nimba, Amrda, Vrsha, Padola, Nidigdiga. The best Pitta Samana rasa is Tikta rasa. You know, what are the common rasas for Pitta? Are you classically oriented or not? Then tell me, what are the rasas indicated for Pitta? Exactly. Kashaya, Tikta, Maduraha, Pitta Manyedu, Kurvade. Let us analyze one by one. Kashaya is, of course, good Pitta Samana, but Kashaya is Ama Samstampana. Kashaya will do some Stambana in the Ama condition. So it is not that much good. Okay. Then Kashaya, Tikta, let it be there. Madura. Madura is also good against Pitta, but Madura will increase Kleda. Madura will increase Ama, so that is not that much good. Okay. Then among the Kashaya Tikta Madura, the safe rasa against Pitta, which will empower Agni, is the one and only Tikta. Are you getting me? Luckily, Acharya told only 6 rasa. We are happy. Imagine. I think Vagbada and Susruta Charaga were so confident that there will be a future course by CCIM called BAMS. बच्चों को पढ़ना होगा, इतना पढ़ने में मुश्किल होगा, गोपकुमार जैसा मंगा आता है पढ़ाने के लिए, इसलिए 6 rasa is enough. No, he was a very good foreseer. Okay. And then among the Kashaya, Tikta, Madura, Tikta is the best against Agni. Tikta is best against Pitta. There is only one rasa among the Shad rasa, which is Pitta Samanam and Agni Dibanam, that is Tikta. That is why, my dear friend, all the drugs in Ayurveda are unfortunately Tikta. When first year students came to my college last year, every time they will come to see the hospital, because they don't know anything in Ayurveda. They will be simply taken to the hospital to see these are the big things in the hospital. I had shown them Panchakarma theatre, everything. They don't know anything in Ayurveda. First year, next 2-3 days only they are coming to me. Then one boy asked me a very important question. The question no Vagbada, no Bhela asked to his Guru. You know what is this question? Very innocent question by that student. Very innocent question by that first year student. Sir, I have seen all the medicines, all are bitter. And I was very happy to go to your Panchakarma theatre. I could see jaggery, honey, and all the meetha wala hai. But you give all the madhur rasas through the rectum as vasti, and you give all the tikta rasas through mouthas.
Why this, sir? Why? See, that is the current generation question. You are buying sarkara, guda, sida, madhu, matriga, honey, mixing everything. I was palatably waiting. You are giving through the rectum. And you take Panjaditta Kashayam, Gugulita Kashayam, Nimbadi Kashayam, giving to the patient. How I can tell Kapha is there and Vada is here? See? For Vada you need Vasti, for Vasti you need Madura. So my dear, that is what I am telling. Certain principles in Ayurveda are like that only. So, Tikta Rasas are. So, Tikta Rasa, among the Shadrasa, Tikta is the only rasa which is having Pitta Shamanam Agnidevanam. That is why when there is Amla Pitta, acidity, antral gastritis, Parinama Shula, GERD, gastroesophageal reflux disease, only option is Tikta Rasam. Tikta Kashayam, Mahadikta Kashayam, Panjadittagam, Nimbadi, Padoladi, Yeshtiadi, all are indicated. So my point is very simple. In Pitta dominant skin disease, you will be getting all these lesions. Pitta dominant hair disease, you will be getting premature graying. That is what I am telling. Paladi, Shoga, Kroda, Seriroshma, Sirogada, Keshansa, Dosha, Pajadi, Palidam. The treatment is internally Narasimha Rasayanam, externally Prabondarigadi and Panjadittaka Chida Pagam. Always tell bye-bye to Levana if you want a good hair. You know, what is the property of Levana? Levana has Tamba Sangada Shaidilyagaram. Levana will remove the Sangadam. Now, what is Sangadam? Sangadam means the hair follicle is deeply rooted there. That Sangadam will be removed by Levana. Levana will remove the Sangada because it is Tikshna. You know why you are adding Levana in Vamana? When you do Vamana Karma, you will give internally Saindavam plus honey. What is the logic? Sarveshu tu Vamaneshu Madhu Saindavam Kapha Vilayana Chedanartham Ubadishyade. My dear friend, listen carefully. The combination of Levana plus honey will remove the kapha, kapha vilayanam. So when there is kapha, there is alinganam. When that is lishalingane, kapam. So when there is kapha, there is proper binding. When there is kapha vilayanam, the root will become very weaker and the hair will easily go. That is why never take more levanahara, especially in condition. And when you take levanahara, supply with tiktaga, namely panja tiktaga kshidapaga. And how to identify the kapha dominant dosha? Whitish discoloration, raised skin lesion, vesicle bulla, severe itching. This is very important. The presence of itching is directly proportional to internal kleda. No, kleda is the technical name in Ayurveda given to the kapha related dushti. Just like ama in kosta, kleda in rekta. The internal ama will manifest externally as lack of appetite. Am I right? The internal ama will externally manifest as lack of appetite. Internal kleda in the recta will manifest as itching. So more kleda, more itching. The best drug to bring down the kleda is Shilajadu. That is why kleda shoshana is Shilajadu, and that is why we prescribe Chandraprabha Guliga, Shiva Guliga, etc. when there is chronic kapha related damage in the skin disease. A chronic skin disease with more kleda. How you will identify kleda? A oozing condition, chronic condition, non-healing condition, definitely there is internal kleda. Internal kleda can be identified by external itching, and the lesions will be long-standing, chronic with pruritus. So that is why always you have to give against kapha. The best yoga is again externally Yeladi. In all these impetigo, this is impetigo. I will tell you again. Impetigo contagiosa, we will always do chalana with tripala kashayam. Then we will apply Eladi churna in takra. Why takra? Buttermilk. Buttermilk is again best against kapha. Takram leku kashayamlam deebanam kapha vata jits. So lepana with takra, lepana with coconut milk, etc. are indicated in all such conditions. Okay. Then hair pathologies, Kalavi, Palidam, already we discussed nail lesion. Most of the skin disease will be manifested with nail pathology. See, Ayurveda very well told Kesha Nakha. When Ayurveda told Kesha Nakha, we never gave any much importance. Ayurveda will tell like that only. Okay. But when psoriasis came, Most of the psoriasis patients will develop psoriatic arthritis. According to the modern rheumatology, 30% of the psoriasis will lead to psoriatic arthritis. And you know how to differentiate? The people who are having nail changes, pitting in the nail, brittle nail in the terminal edge, and those who are having a nail pathology, they will be highly affected by psoriatic arthritis in the future. So my point is very simple. Ayurveda very well gave a clue that a nail pathology can predict a joint pathology. Are you getting me? You just go to the modern medical science, 30% of the people suffering from nail pitting in psoriasis will be affected by psoriatic arthritis in the future. So examine the nail, examine the hair when you are getting a dermatological case. That is very much mandatory. Okay, now hair pathology, Shiro Roga, Togu Roga, Shudra Roga, and systemic disease. These are the terminology. Shiro Roga, very much important. We have all told Darunagam, Arumshiga, and both are representing the dermatological condition. Arumshiga, we always treat with the Datura. You know, Datura, we will make the decoction of Datura, and that is for Chalana in Arumshiga. Arumshiga will be having small hair, Pidaga, something like that only. And Siddhartha Ganifa, they will be having small Pidagas. And then Toguroga, again Shudraroga, we are having so much of skin disease and hair disease. Indralupta, you very well know. Indralupta is a case where Romakubanugam Pittam, Vadena Saka Murchayan, Prachyavayadi Romani, Tadastesham na Sambhava, Tad Indraluptam Richimja, Prahus Chajed Javaram, typical alopecia. So when you are getting Indralupta, Pitta plus Kapha. Pitta will remove the Kapha component from the hair follicle, then the hair root will become very, very weak, easily it will be going out. That is why Romakubanugam Pittam. See the word. Ayurveda never tell that Pitta is free from even Romakuba. You know, according to Ayurveda, there is a beautiful question asked by Agnivesha to Atreya. Listen carefully. Agnivesha asked so many questions to Atreya. If Agnivesha was not there, no Ayurveda. His questions only led to Ayurveda. And there is a chapter in Charaka Samhita, Sharidasthanam, Kadida Burshiyam, first chapter. There Agnivesha asked him, his guru. Guru se puta hai, Vedananam Adishtanam Kim. What are the Adishtana for Vedana? He is giving the answer, Atreya. Vedananam Adishtanam Mano Degascha Sendriya Kesha Loma Naka Vina. So Kesha, Loma, Naka. Body hair, Loma. Head hair, that is Kesha and Naga. So Kesha, Loma, Naka, Chodkar. Pura body is affected by pain. Then he is telling, even though it is not having pain sensation, it will lead to pain to the pupil. You know, that is why Sar is having a clinic. No? If there was no Kesha, no clinic. So what I am telling, so even though Kesha, Naga don't have a pain, they can lead to pain. That is why Kunakam is mentioned. Kunakam is mentioned, Indralupta is mentioned, Arushika is mentioned, Kaladi is mentioned, Paladam is mentioned. So my point is very simple. Every time all these areas should be explored with the systemic disease. And the key Samprapti factor is Rodho Dushti. See, the main reason, now I will come to the management. The main treatment for hair disease can be identified by the Samprapti. Identify whether there is Vata involvement. Generally, Uttamanga is Kapha. Am I right? Generally, Uttamanga is Kapha. Urakanda, Sida, Klomakan, everything is Kapha only. In that area, if there is more Vata, you will be getting dry, brittle hair. Spudida, Dusara, Kesha, Gatra. Typical term. Spudida, Dusara means terminal ends will be split into two, brittle, dry hair, and always apply Murdini Taila. Murdini Taila is the management in Vadiga, Shiroroga, Vadiga, Kesharoga. How you will apply Murda Taila? Shiro Abhyanga, Shiro Piju, Shiro Vasti, Shiro Dhara. Shiro Abhyanga, Shiro Piju, Shiro Vasti, Shiro Dhara. Beautifully told by Vagbada. Kaja Sadana Sidatto Pinjaratvam. See the beauty? Kajam means Kesha. Kaja. Kaja Sadanam, fall. Sidatvam, graying. Pinjaratam, brittle. Every hair problem in one sutra. Kaja Sadana Sidatto Pinjaratvam. Paribudanam, breaking. Paribudanam Shirasa Samira Rogan. You apply Jayadi Janayadi Indriya Prasadam Sorahanu Murda Belam Cha Murda Tailam. In my clinical experience, Narayana Tailam, Vadashani Tailam, Dhanondaram Tailam are best against Vadiga hair pathology. Narayana Tailam, Dhanondaram Tailam, Vadashani Tailam, best against Vada, and best against Pitta for Murda Tailam is Chidabala. Chidabala is best against Pitta affected with Shiroroga and Kesharoga, and best against Kapha is Karpa Sastyadi. Karpa Sastyadi is Rodo Shuddhigara drug. So best Shiro Vasti Shiro Dhara drug if there is a Kapaja Toguroga in the skin, Kapaja Roga in the hair, it is Karpa Sastyadi. Pitta Roga in the hair, Chidabala. Vada Roga in the hair, Dhanondaram, Narayanam and Vadashani Tailam. Then next is Kesha Shadam. Kesha Shadam is always caused by less kapha and more pitta. When kapha is enough there, that will give strength. When kapha is getting down, the hair follicle will become weak, and you have to always give a kapha kara chikilsa. We will give a certain mamsarasa prayoga, yusharasa prayoga. We will give a certain kapha increasing drug like grida preparation. In my experience, we are giving Vidaryadi Gridam. Vidaryadi Gridam is a very good hair nourishing Grida because that is indicated for Shosha. You know what is Vidaryadi Gridam? I will tell you the yoga. Vidaryadi Rayam Hridyo Brahmano Vada Pittaka Shosha Gulma Anga Mardurda Shosa Kasakarogana Urda Gada condition Vidaryadi is there, and that is a very good drug against Dadusha. A nutritional deficiency manifesting as Vadiga hair disease, you think about Vidaryadi Gridam. So Vidaryadi Gridam with Pravala Fasmam. Normally I am giving like that. You know, calcium Fasmas are there. Pravala Fasma, Stringa Fasma, Kukudanda Fasma. Any such calcium powder, 3 gram with 15 gram of Grida. 15 gram Vidaryadi Gridam plus 3 gram of Pravala Fasmam is the best choice against Shosha, Dadushaya, malnutrition, Vadiga, hair disease. The next combination is Brahma Rasayanam. You know Brahma Rasayanam? Brahma Rasayanam is a popular yoga. Brahma Rasayanam is also given with 15 gram with any one of these. And Brahma Rasayanam ko chodkar you can even give about the Indugandha Gridam. There is a very good proven combination in my practice. Early morning before food, 6 o'clock in the morning, I will give 15 gram, 15 gram Indugandha Gridam. You know Indugandha Gridam? That is a very good Ojogara drug. Indu means moon. Indu Kandam means the Grida will like Kandi lecture to the moon. Indu Gandham, immunomodulatory. 15 gram Indu Gandha Gridam early morning, 15 gram Brahma Rasayanam evening are the combination for almost all the nutritional deficiency related Vadiga hair pathology. So don't forget Brahma Rasayanam, Indugandha Gridam, and the Vidaryadi Gridam with the Pravala Basma, etc. important. Then Kesha Vaivarna. Kesha Vaivarna means any coloring problem to the Kesha, we always give again Pitta Chikilsa because Pitta is very much important for pigmentation, and excessive Pitta will be leading to the Kesha Vaivarnya. You can think about the previous drugs what I told earlier, Narasimha Rasayana, Prabondari Gadigera, and even you can give a Shadavari Chidapaga, and even you can give a Manjishtadi Kashayam. Manjishtadi Kashayam and Tiktakam is compoundly given. Manjishtadi Kashayam plus Tikta Kashayam is given in a combination, plus externally Prabondari Gadigeram and Narasimha Rasayanam are the drugs against Kesha Vaivarnya. So Kesha Shadam, Kesha Vaivarnyam are mainly due to opposite pathologies as per Ayurveda. Then coming to the major nidanas for hair pathology, Viruddha Ahara, Vidahi Ahara, Levana Ahara, Pitta Prakopa, Dadu Sarahinata. This word is important. What do you mean by Dadu Saram? The essence of Rasa, Rekta, Mamsa, Meda, Asti, Majja, Shukla is called Saram. The essence of the tissue vitality is called Saram. You can see all the Saras are applicable in, all the Nidanas are applicable in the contemporary scenario. And Viruddhaharam, Vidahiyaharam, Levanaharam, Pitta Pragobam, Dadu Sarahinata, all are there. You know what is actually the role of Viruddhahara? Viruddha will definitely lead to problems in the immunity, and Viruddha will create a circulatory stagnation. Vidahiyahara will lead to cellular level metabolic toxin accumulation. The word Vidahi means which will take more time to digest. Whatever you tell Vidahi plus Viruddha, they will always cause Rekta Dushti. You read Vadaraktam. Vidahennam viruddham cha tattacha asrik pradushanam. The combination of vidahiyahara plus viruddhahara will be always causing damage to the skin as well as hair. That is most important. And you can see seborrheic dermatitis. This case is from again our college we have treated. Seborrheic dermatitis, excessive kapha pitta. There will be very foul smell will be there. Durgandha will be there. The greasy hair. Hair will be always greasy in nature. More kapha and pitta will be there. And you can see the superficial layers will be going away. And we will make Arkadi Kashayam for Chalana. You know Arkadi Kashayam? Arkadi Kashayam is a very Tishna yoga. Arkadi Kashayam or Surasadi Kashayam. Any one. You can select and make the decoction and use Shirodhara continuously. After cleaning the dhara with the dhara, you can apply Eladi Churnam with buttermilk as Shiro Lepa. So first we will cut the hair into short, or we will even shave the hair. Then we will be doing the dhara with Arkadi decoction or Surasadi. Both are Kapashamana. Because the skin will be having extreme foul smell will be there. That is seborrheic typical dermatitis. More snigdha kleda. What is kapha dosha guna? Juniors, kapha dosha guna? That is your title sloga. Title sloga you need. Snigdha, Shida, Gudur, Manda, Slashna, Mrisna, Stira kapha. Each word is applicable to this disease. Actually, when I present a paper, automatically this logo will come to mind. That is why I am asking to you. I never thought that standing in Pune at 11:35, I will ask this question. No. I never had a plan in my mind that 11:35, what is kapha? No. So accidentally the picture is showing that Snigdha, Slashna, Sandra, Mrisna, Stara, all properties are sticky. The sebum, the seborrheic pathology will be like that. So Chalana and Lepana is very much important in seborrheic dermatitis. You need a continuous treatment. Once you clean it, it will be okay, but it will again come. So that you need a continuous treatment. And then we will apply a oil called Dardura Patradikeram. Do you know Dardura Patradi? Dardura is a drug called Deturastramonium. It's a poisonous drug only, but that is very good indicated in dandruff. Dardura Patradikeram. Dandruff and Dardura you can remember. So Dardura Patradikeram, that is indicated for Shirodhara after having Chalana with Arkadigana, Surasadigana, Lebana with Eladi. And next yoga is Nimbadikeram. Nimbadikeram available in the market. Dardura Patradikeram available in the market. Both are good against these conditions of seborrheic dermatitis and dandruff. And internally you can give some medicines which will be kapha pitta shamana in nature. By kapha pitta shamana, itching will be there, sebum will be there, whole smell is there. So it is a kapha pitta. I will tell you the worst combination in skin disease is, can you tell among the dosha? Vata pitta, vata kapha, kapha pitta. Which is the worst combination? Actually, there is not such a question and not such an answer, but I am telling from my practice, it is kapha pitta only. You know, all kapha pitta condition will never heal. Kapha treatment will be always Ushna. Pitta treatment will be always Shida. Kapha is Snigdha Shidam. Pitta is Ushna Snigdha. Kapha is Snigdha Shidam. But Pitta is Ushna Snigdha. Both are opposite only. So you know the nature of the patient, it will be always oozing, foul smell, getting discharge, itching. So once you treat the itching, the kleda will increase. Once you treat the kleda, durgandha will come. So kapha pitta is the worst condition. You know there is a disease called Kardama Visarpam. Have you heard about Visarpa? Visarpa is a notorious skin disease which is too notorious for recurrence. And Visarpa will be having all pathological problem. Whenever you give internal grida, Visarpa will aggravate. You can never give a medicated grida in only one skin disease, that is Visarpa. You have to be extremely careful. I am telling you, whenever you feel that patient is getting very well, you are giving some Mahadiktaka Gridam, next day the itching will start. Because Mahadiktaka Gridam, even though indicated for skin disease, which cannot be given when there is a kapha pitta combination, and this is such another example. Hair pathology ho ya skin pathology ho, when you are getting the combination of kapha plus pitta, it will be extremely difficult because the treatment is very much opposite. So kapha pitta treatment में क्षालन करना, धारा करना, लेपन करना और अंतिम में अगर कोई भी किसी भी कुछ भी कब नहीं है तो आपको स्निग्ध का प्रयोग कर सकता है. उसी में भी आपको चिंता करना, आपको देना है दर्दूर पत्र आदि, निम्बादि, ऐसा पित्त शमन करने वाला योग को देना है. So that is very much important. Again, you can see these are the some yoga where crust are there. You can see alopecia before crust are there. In such conditions, we always use the Chiri Varsha Tok Dhara. You know, Chiri Varsha, Negroda, Udambara, Ashwata, Plaksha. What is the property of all these four? All these four are Kashaya, Tiktarasa, and Madhura Vipaka. Kashaya Rasa drugs are excellent against cleansing. I am repeating. Kashaya Rasa drugs are excellent against cleansing. If you want to make a lotion or antiseptic lotion, preferably that should be from such drugs. So here we use Plaksha, Udambara, Ashwatha, Negroda. The bark will be taken, that will be converted into Toya Bhaga, which will be used for Dhara, and then that will be having more results. So my point is very simple. These are the typical Kapha Pitta condition, and finally it will come to Vada. See, almost all the diseases of the skin and hair, if not treated properly, will land into Vata. Initial Kapham means Dhadu Mala Sanchayam. Middle Pittam means Dhadu Pagam. Last Vada means Dhadu Kshayam. Are you getting me? I am telling a golden principle. Every disease in the contemporary lifestyle will start with metabolic toxin accumulation, Dhadu Mala Sanchayam Kapham. Next stage, Pitta domination, Dhadu Pagam, necrosis, Pittam. And finally, degeneration, dehydration, demyelination, Dhadu Kshayam. So, Dhadu Mala Sanchaya Jenya Kapha condition में लंघन करना, धातु पाग पित्ता कंडीशन में गृद देना और धातु क्षय वादा कंडीशन में रसायन देना. That is the natural order of etiology and treatment. Are you getting me? Yes or no? I think your SC is becoming weak and weak and weak. I think your internal fire is coming down. No? Okay, so I will tell you, initially, see, when you are getting edema, it is kapham. When you are getting daha, raga, paga, pittam. When you are getting crack, vada. So almost all the skin hair pathology will follow this order. Dhadu mala sanjayam kapham, dhadu pagam pittam, and dhadu shayam vadam. So again you can see kapha pitta conditions are there, and finally drying and becoming vata. Clear? Here chalana, lebana, dhara here, and murdini taila here. Kashaya dhara here, taila dhara here. Getting me? Yes or no? Kashaya dhara here, taila dhara here, kapha pitta here, vada here. That is the comparison of hair conditions in our science. Okay. Then tinea capitis, we always use the Gandhaga Thailam. Tinea capitis, you are getting so many conditions are there. Gandhaga Thailam is widely given. Kimsuga Patradi Geram is widely given. Malatyadi Thailam. These are the three oil which we generally give in such condition. Kimsuga Patradi Geram, Malatyadi Thailam, and Gandhaga Thailam are generally given. And in certain condition, you can give Indralupta Mashi, Hastidanta Mashi, Traphala Mashi. Nowadays we are getting. And I internally give Mahatiktaka Gridam. Internally, the best grida for hair fall and such pathology is Tiktaga related. Actually, my favorite yoga in Pitta is Tikta Grida. When you are getting time, today my humble ventricular request number 2. Today after reaching your home, you open Ashtangradayam Chikilsasthanam. I think that text is with you. Is it there? Take it somewhere, it is there. That is waiting for you only. Okay. So open the text and go to the Kushta Chikilsa. There is a yoga called Tiktaga Gridam. You read it. Today itself you read it and you should message me. Okay. And I had told the same thing in a seminar in Bengaluru. And when I was waiting for the flight in the airport, I am getting all that much number of WhatsApp. All are reading Tiktaga Grida and the screenshot they are giving and sending me. You know why I am telling? I will tell you the yoga. I will tell you the yoga. After reading, you will also be agreeing with me. The yoga is like only Padola Nimba Kadaga Darvi Pada Duralapam. I repeat, Padola Nimba Kadaga Darvi Pada Duralapam, Parpadam Trayamanam Ja Palamsham Paje Dabam, Sarpisho Tiktagam Jayed. Now see, Pitta Kushta Parisarpa Pidaga Daha Brahman Kandu Pandomayan Gendan Dushta Nali Vranabaji Pagandaram Abasmaram Udaram Pradaram Geram. Finally, Vagbada got exhausted. Telling the sloga, Arso Asravitta Manyamsa Sugichran Pittajan Gadan. You know, when Vagbada was reciting the sloga, you imagine the condition of the Shishya. I told you, you know, the listener's dukkha. I remember the listener's dukkha. So Vagbada was telling this sloga like that only. Shishya was looking like this only. Then Vagbada was a student loving Acharya. He identified that this Shishya cannot tolerate much. So finally he told, I am not lengthening the sloga, my dear. I am concluding. How I am concluding? Arsho asravitta manyamscha sukichran pittajan gadan. See the beauty? I am not continuing the sloga. Whatever pittaja diseases are in dunya mein, kya pittaja disease hai, bimari hai, tik tak dena. Shishya became very happy. He is asking, you could have told in the beginning only, no? Why you are telling all these diseases? I am not joking. See, because he gave some clue. He gave some clue. Pitta Kushta Parisarpa Pidaga Daha Trid Brahman Kandu Pandomayan Gendan Dushta Nali Varna Abaji Pagandaram Abasmaram Udaram Pradaram Geram. Full ra only. Pagandaram Abasmaram Udaram Pradaram Geram. Why ra? Vagbada was student loving. Why Vagbada was student loving? He wanted that the Shishya should by heart it. That is why I know this sloga. Pagandaram Abasmaram Udaram Pradaram Geram. Then Shishya started gazing the Vagbada, told, Arso Asravitta Manyamscha Sugichran Pittaja. Exactly correct I am telling, my dear, from my practice I am telling you, when you are getting a Pitta Prakriti patient with a high cholesterol level, you have to do Snegabana, only one option, Dikta Gradam. Somebody is coming with the Pitta Prakriti, all hypertension, irritability, hyperthyroidism, menopausal syndrome, full Pitta only. Most of the people in the generation are Pitta only, no? They will be easily attacked by all the emotion. And when they get a Medo Dushti, I am repeating, Pitta Prakriti with a Medo Dushti, you cannot do Snegabana with any other drug. Because Sneha means Grida will increase the Pitta. Sorry, will increase the Medas. So, one Grida which is Pitta Samana, that is Tiktakam. Are you getting me? Pitta need Tikta. Medas need Shosha. 2 in 1 Tiktakam. Now it is clear. Actually, for every yoga, there is a biochemistry behind that. Vagbada, no, this bimari ke. See, when I was a junior student, I was very much thinking, wow, this much number of yogas he told, bhaiya. इतना योग क्यों बताया? CCM की syllabus में है, मुझे पढ़ना है. Later I identified that for every yoga there is a patient. Ayurveda always treat patients, not the disease. Ayurveda रोगी का चिकित्सा करता है, रोग का नहीं. दोनों रोगियों को दो बीमारी है तो ट्रीटमेंट बिल्कुल अलग होगा, क्योंकि रोगी is important. So अल्प पित्ता, मध्य पित्ता, अधिक पित्ता. Pitta in Medas, Pitta in Dasa, Pitta in Rekta. Different combinations you need. So when in the contemporary lifestyle disease and metabolic syndrome, obesity, Staulya, with the Pitta, with the cholesterol, with the skin disease, with the diabetes, with the fatty liver, think about Tikta. Now you understood, no? That is why you will, no, actually when you start touching the core spirit of Ayurveda, you will start love with Ayurveda. Then we call it as Ayurvedic Valentine Day. No, you will feel that I am loving Ayurveda. So then every day, to me, Tikta Hrida is a beautiful girl. I love her. I am telling you, no, to me, Tikta Gridam, Aragodam Hadikta Gridam, Ashtajurnam, Gugula Banjabarjurnam, all are beautiful creatures. We will naturally feel in love with them. And then I will always wait for my Tikta Gridam. Tikta Gridam will love me. And when I love Tikta Gridam, my love will do the treatment. No, if you simply write Tikta Grida with no Chedana in the Atma, Tikta Grida will be only a fatty substance. But when you love Tikta Grida and you give her, you go and treat her, she will do the duty. Am I right? You are telling something to your wife, go and do. She will prepare roti, khao. कोई टेस्ट नहीं होगा. हमारा पति आता है, इतना मुझे प्यार करता है, आपके लिए इतना स्पेशल रोटी है. That will be more tasty, no? Like that only. You love the yoga, yoga will heal the disease. Are you getting me? Love the yoga, that will heal the disease. And how you will love the yoga? Today read Ashtangridayam, Tiktagridam. I am waiting for your WhatsApp. Okay. So that is why tinea capitis we are treating. Actually, one part is over. So many things are there. Okay, we will go to some. Now I will tell important skin disease. Already it is 11:50. Important skin disease. You need any break? You are okay, no? Okay. So I will tell important skin disease and their management. फटाफट करके हम बोलेंगे. See, eczema, most of the skin disease will start with eczema only. The term eczema and dermatitis are used synonymously. Redness, usually with ill-defined margin, papule, we call it as Vijarchiga in Ayurveda. Generally, eczema can be called as Vijarchiga in Ayurveda. Sakandu, Pidaga, Shyava, Lesigardium, Vijarchiga. The Lesigardium is always there, and this is the typical picture. There are so many types are there. You can see this is the atopic dermatitis. Atopic dermatitis, when the detergents are excessively used, it will become more vadiga. And contact dermatitis, you can see due to the allergy by the footwear, allergy by the belt. So anything which will be causing contact dermatitis is considered to be the Vijarchiga. The main medicines which we are giving in Vijarchiga, if it is Kapha dominant, Aragodadi Kashayam. If it is Pitta dominant, Padoladi Kashayam. If it is Kavapitta dominant, Guduchyadi Kashayam. Listen carefully. I will tell Chilsa along with the disease because we don't have that much of time. Eczema means dermatitis, mainly caused by external contact. So it can be also called contact dermatitis. The best terminology to accommodate is Vijarchika. The sloga is Sakandu Pidakashyava Lesigardium Vijarchiga. If it is Kapha dominant Vijarchiga, Aragodadi. I am telling Kashayam. If it is Pitta dominant Vijarchiga, Padoladi. If it is Kapha Pitta dominant, Guduchyadi. So that is the yoga. Guduji, Patnagarishta, Dhanyaga, Rekta Chandanam, Pitta, Sleshma, Varnachardi, Daha, Trishnaginam, Agnigir. That is Guduchyadi. Padoladi means Padola, Nimbagadaga, Darvi Pada. Padola Kadokiniadi is exclusively given in oozing condition with more Pitta. Nikandi, Kavapitta, Vishamajuram, Visham Vami Marojagam, Kamala. That is Padoladi. So contact dermatitis, you have to remove the allergy, and then after getting the external Pitta Shamanam, you have to remove the internal Vyadichamata problem by empowering Grida. I am telling you, the allergy can be delayed by Grida. In my practice, I am giving Indugandha Gridam 15 gram with 5 gram Haridra Churnam. There is a ready-made yoga called Rajanyadi Churnam. There is a readily available yoga called Rajanyadi Churnam. Rajanyadi Churnam is indicated for pediatric skin disease, but even then you can prescribe 15 gram Grida plus 5 gram Rajanyadi Churnam. That is the safe prescription against almost all the dermatitis conditions externally. So internally you can give. Externally, as per the previous slides, Chalana can be done. Then tinea ringworm infection. Group highly contagious segmented fungus, commonest fungal infection in tropical country. It is diagnosed based on the site of the involvement. Everybody know. And And here, basically I told you, Gendaga Thailam is given externally, Kimshuga Patrari Thailam is given externally, and Chalana is done by Lodra. Lodra? Symboloccus larina. Lodra Tok is very good against fungal infection. So we will take a Lodra Tok and Nada or Tagara. That is also best. And even the Shyamaga, Shyamaga, the variety of Trivir, Shyama Trivir. So that leaves is also very good. We will apply a Lebana. So that is best against tinea and ringworm infestation. Coming to psoriasis, the very notorious disease, non-infectious inflammatory disease of the skin characterized by well-defined erythematous plaque with a large adherent silvery scale. You can see plaque psoriasis, gutte psoriasis, and there are different types of palmoplantar psoriasis, and all the psoriasis will be affecting the skin plus hair. You can see this is the typical scalp psoriasis, That is why Ayurveda beautifully told, Sitmam Rucham Begisnigdam Anda Krishtam Rajaha Kired Slashna Tanusheda Tamram Dautiga Pushpavad Prayena Murdakaye Syad. Ayurveda very well told it will affect the scalp. Prayena Murdakaye Syad. It will affect the scalp, and then psoriasis can be treated. according to Vata Kapha pathology. These are the two signs, my dear junior doctors. For your clinical examination skill, I am telling something extra. You just take a glass rod and remove the superficial layer of that scaly layer, then you can see candle grease sign. You will see just like the candle grease. And then you can see pinpoint small hemorrhagic spot. I am telling you, when you remove the superficial scale from a psoriatic patient, under the layer you can see pinpoint spots. That spots are called auspit sign. So the presence of candle grease when removing the layer is called candle grease. So candle grease sign plus auspit sign will definitely confirm that your case is a pakka psoriasis only, and it is treated according to Vata, Kapha, Kushta. I always do Vamana Karma. I always do Vamana Karma in my practice for psoriasis. I will show you the video. To do the Vamana, listen carefully, I am showing you something different. To do the Shodhana or Vamana in psoriasis, you need minimum 7 days of Snehapana. But never start Snehapana directly. You assess the Agni of the patient. You can give, listen sharply, use your best brain for the next 3 minutes. Okay. You always give Vaishwanara Churna, Ashta Churna or any other Churna to empower the Agni for 3 to 5 days. Then only start Snehapana. I am telling you, you never believe the appetite of the patient. I mean, Agni is something beyond the appetite. Appetite is only the indicator. To me, Agni is something above that. So you just give a minimum 3 to 5 days. Vaishwanada Churna, exactly. Vaishwanada Churna, Panchakola Churna, Gandharvakasta de Kashaya, something. Then only you start Snehapana. So give Agni Dipana first, then Snehapana 7 days, preferably with Aragoda Mahadiktaka Gridam. A very popular yoga exclusively for psoriasis. Aragoda Mahadiktaka Gridam 7 days. What I am doing, the first day I will give 50 ml early morning. Then I will wait how much time will be taken to digest the Grida. If I am giving 50 ml at early morning 6 a.m., listen carefully, if I am giving 50 ml 6 a.m., the patient will tell, sir, I am getting appetite only by 9. That means 50 ml of Grida took 3 hours for digestion. Are you getting me? I am seriously talking. Okay. And then accordingly, you increase the dose for the next day. The maximum dose for a Snehapana before Vamana is that much quantity of Sneha which will take 24 hours to digest. I am telling the science. Sharpen your brain. The maximum dose of Snehapana for a patient to do before the Vamana Karma is that much quantity of Grida which will take 24 hours. We cannot go up to that. But minimum it should go up to 12 hours or even 8 hours. So what we will do, first day I will give 50 ml. Next day I may go to 75 or 100 ml, and gradually I will increase up to 200 ml on the 7th day, by which he may develop appetite in the evening. Actually, Ayurveda told, no, are you ready to listen something more? Yes, I will tell you. Dophyam Chadurpur Ashtapur Yamair Jirandi Yakramat. Dophyam, 2 yama, 4 yama, and 8 yama. You know, 1 yama means 3 hours. So 2 yama means 6 hours. The Grida digested by 6 hours, the Grida digested by 12 hours, the Grida digested by 24 hours are the Hraswa, Madhyama, Uttama Matra for Snehapana before Shodhana. Getting me? I am quoting from the science. 1 yama means 3 hours. So, Dophyam Chadurpur Ashtapur. 2, 4, 8. 2 into 3, 6. 2 into 4, 8. And 2 into 12, 24. So, the yama which will take only 2. That means 6 hour digestion means Hraswa. So, what I should do? I should give that much quantity of Grida which will be digested by minimum morning 6 to evening 6. That Grida should be taken by the patient before Vamana. Are you getting me? Otherwise, you are not doing Snehapana as per classic. So, what we are doing in the practice, first day morning 50 ml, Patient will develop appetite by 8 o'clock. Second day, somewhat 75 ml, 9 o'clock. Third day, 100 ml, 1 o'clock. Fourth day, 150. Fifth day, 4 o'clock also, the patient will not be having appetite. I will go to the rounds. How is your appetite? He will be angry on you. आता है फिर देता है क्या करता है मुझे क्या होगा क्योंकि the patient never studied BAMS, no? Okay, we only know what is BAMS. So we will increase up to that quantity by which he will be getting appetite by the evening. Then the next day full shodhana, we will do full svedana, etc. And then the next day vamana. Now I will show you the video how vamana is done. Early morning you bring the patient to the Panchakarma theatre. The previous day give some idli, laddu, peda, jilebi, masha, which for ulklesha, for facilitating the vamana, and then give the vamana drug. I am telling my yoga, 2.5 gram of, listen, I will tell you. 2.5 gram of, I told you the best sharp 5 minutes in the entire day. 2.5 gram of madana churna, means the seed of madana. 5 gram of vacha, 7.5 gram of st madhu, 10 gram of saintava. Very easy to remember. 2.5 madana pippali, 5 gram vacha, 7.5 gram st madhu, and 10 gram saintava mixed with honey in half glass of milk. That is the Complan. I am a Complan boy. Only look only in Complan, the smell is very irritable because vaja is there. Okay, and this will be given, and patient will be waiting for 30 minutes, then starting Vamanolsavam. He will be having Vamanolsavam, Vasantolsavam. It will start by 6 o'clock in the morning up to 7. After getting the entire Vamana, we will give him Dhumapana, Kabala, and that day only Legu Ahara, Peya, no heavy drug, no heavy diet. So this is Vamana. Now let us see the video. So many Vamana karma we do. You need tea? No, I don't need. He will have lunch. Okay, dear, listen. See, these are some of these. You can see Ganga Pravaham. See, whenever your Snegavana is good, then only you will get such a wonderful Vamana. This is not Photoshop, real patient only. You will see the anime, you will see the original video now, because when you give the very good Snegavana, I can see, when my patients are vomiting, I will be the happiest man. Because I am always standing like that only, because when they vomit with that much of ulgara, without any nirvibandam pravartande kavabitta nilakramad, without any obstruction, you can see the patient full body plaque psoriasis only. You can see the full body plaque psoriasis only. Again, some pictures are there. See, these are the medicines we are giving. Every day in my hospital, there will be minimum one Vamana. I will show you the video now. So this is the preparation of the patient. We are giving, this boy is from Pune only. He was my student who studied, who came to Kerala. Okay, this is the first. You know how you can identify a PG student in a video? How you can identify a PG student in video? They will be always in the back sides. They will never come to forward. They are simply, what will happen? They are from Orissa. And not telling Orissa is always sitting back. No, students are like that only. Okay, now we will see the next video of the same patient. See, always you have to support the, see, this is the proper position. The entire body is covered with, see the body. And you can see the full body, and you have to support this like that only. And that girl is counting 1, 2, 3 for Vegas. See, the example I will tell you, actually when you are so confident, you will feel the exact moment of vomiting. Once my students were there to catch the picture, and I told them, you should catch the photo before the vomiters touch the ground. You know, idhar se idhar aata hai na, 1 second. So I told you, then I told them I will be giving a prize to the best photographer who will take the vomiters before touching the land. All are very much careful only. They don't know when they will vomit. It became failure only. Then I understood. So I was holding their lelada. You know, in the sloga, sir, you just, he's my brother only, so I can use him. Okay. So actually, when we do the Vamana Karma, you always hold the hand into the lelada of the patient. Ubhe parshve leladascha vamadaschasya dharayet. And you will feel in your hand that the Vega is coming. I cannot explain it. That is only felt by your hand. So if I am keeping like this, I can always, he will be like this only. No, he doesn't know when I want to vomit. He doesn't want to vomit. Patient never wanted to vomit. No, he will be like this only. He never wanted to know what is ulklesha. And I can easily feel in the hand. Then I will blink my eyes. Then they will click the photo. You know, because I can't talk. Because before that it will come down. So as soon as I am feeling that vomiting Vega, I will blink. They will click it. They click only my blinking, but Vamana will be there. Are you getting me? Oh, that is the, thank you, sir. So that is the experience. I will show you, I show this video. This patient had a very serious psoriasis. We have done Vamana Karma. One more video is there of the same patient. That is a better video. Please see. Very good Vegas are there. See. See. Full body psoriasis only. So I will tell you some clues before I just to see. Okay, I will give you the clue. Whenever you are starting Vamana Karma, the patient should be at extreme level of mental relaxation. Should not have any tension. And he should not be so happy also. I will tell you one negative incident happened in my life. So once I have done 2 patients, same day Vamana Karma came. Because some of I don't know how it happened. We started in 2 different wards, never thinking what is the 7th day. And finally my students told us, sir, tomorrow 2 Vamanas are there. Oh, 2 Vamana means difficult for us. Okay. Then I told we will do in the same theater. So I made them seated in the 2 chair. And I am the teacher, my all UG students are there. I am giving the drug, 2 different drugs only. One is a Unmada case and the second is a thyroid case. Hypothyroidism case and Unmada case. Both are having 2 different. And the thyroid patient started beautiful vomiting. And this patient became very much angry. I am not getting vomiting. I am really telling. I have that picture also. He is staring that person only and staring me only. Because the reason is Gopakumar only, you know. He only given Snegavana to go. One person is vomiting very seriously and he is very happy that he is not vomiting. I am really telling. And then what happened? That patient was removed, okay. And this patient was there. He was very much irritated. This second person who was not vomiting. Then to make him calm, I told whatever jokes I know. I don't know much jokes, so I told some simple jokes. So he was very serious. But after some time, he started laughing, full laughing only, no vomiting at all. I am not joking, so I am telling, never deviate the mind. Then Vagbada is typically telling, Vinjyat Tanmano Bhavet. I am telling you, my dear one, when you are doing Vamana Karma, the patient should focus on vomiting only. He should not deviate for the extreme positive or extreme negative Vamana. You know what is the reason? Limbic system. You know, limbic system is directly influencing the vomiting center. Vomiting center is located in the medulla. And medulla is always influenced by the limbic system. You know, there is a chardi called Dishtartha chardi. Have you heard about it? Dishtapa chardi, the unpleasant sights, unpleasant smell, we will be getting vomiting. The same pathology is limbic system. So unwanted emotions, or we are getting away from the emotion, we will not get vomiting. So Acharya clearly tell you keep extreme level of mental relaxation, not much, not less, to the vomiting patient. That is very much important. And finally, when you feel that vomiting is almost over, you ask 2 questions. Whether your stomach is empty or he is getting any nausea. The feeling of nausea and sweating, they are due to the parasympathetic stimulation, indicates that again vomiting will be there. Roma Harsha, Ayurveda mentioned. Ayurveda never mentioned the parasympathetic system, but they mentioned prasega and nausea. Prasega and romakarsha. Both indicate that the vomiting is still coming. And once you feel that the vomiting is almost over, you give a kabala, dhumapana, paya to the patient. Never do any heavy food on that day. Never give any internal shamana drug on that day. In my opinion, most of the patients who have done Vamana Karma will be having one mild virejana at the end. These are the practical things. Most of them will be having a mild virejana. So I will tell them, go to the bed, wait. If you are feeling something to go to the toilet, go. It is a natural thing only, because Vamanovaga drugs will cause some mild virejana also. So that is the story behind Vamana. So many Vamana videos are there. I think one more is... Okay, and in psoriasis, after the Vamana, so this we have already told. And this particular patient who had Vamana Karma, and you know, this patient we had given the Snegabana Aragudamhadikta Gridam only. Snegabana was Aragudamhadikta Gridam, and then we have started doing this Takkradara. You know Takkradara? Takkradara is a very good treatment in scalp psoriasis. What we will do, we will take the suitable churna, like Eladi churna, any churna which is indicated for Vata Kapha Kushta. Example is Eladi churna, that will be converted into takra by keeping overnight. Next day morning you will churn it and take the takra, and that will be used for dhara. And after finishing the dhara, we will wash the head with the Triphala Kashayam or Amalagi Kashayam, and that will be repeated for 7 days. So Takkradara done for 7 days after the Vamana Karma is a normal procedure in psoriasis, especially if there is scalp involvement. And you know what is the mode of action? Takkradara very well reduces the concentration of cortisol. There are some study. Cortisol is a negative stress hormone which is produced when there is more anxiety. The concentration of cortisol can be minimized by Takkradara, and Takram is very good in Vata Kapha, and Takkradara will control the unwanted proliferation of the epidermic cells in psoriasis. You know why psoriasis is happening? You know why? Normally, listen carefully, 1 minute. Normally, one cell will take 26 days to mature. One skin cell will take 26 days to mature and come to the surface area. But in psoriasis, this phenomenon will be finished by less than 6 days. So there will be unwanted, uncontrolled proliferation of the cell, so that there will be crowding of the cells in the superficial layer. That is what is called proliferation. You are getting all these scales. So normal 26 days will be minimized to 6 days. So super fast proliferation can be inhibited by Vata Kapha treatment of Takkradara. That is the logic behind the Takkradara externally by scalp psoriasis. And the Dravya selected is generally Eladi Churna, Panchagandha Churna, and finally we will be washing it with Amalagi Kashaya. Okay, so that is... I think there is one video for another patient of Takkradara I will show you.
A wick of thread tied to a stick is pushed down through the hole of the coconut shell.
So this is a traditional Takkradara. We use a coconut shell. This is a traditional Takkradara vessel. You can use any dhara vessel. And Takkradara should be done before with mild Shiro Abhyanga. Because Takkradara is generally Rucha. So to avoid a Vada Prakopa, mild Abhyanga can be done previous. Eyes should be closed, because while doing the dhara, it should not come to the eyes. This should be the distance between the head and the dhara. See, the takra will be continuously poured. It is not heated, not heated. And mild massage will be given. And finally, it is washed by Amalagi Kashaya. So, Takradara will be done by a particular medicine, and at the end, we will wash the head by Amalagi Kashaya. So, Takradara is generally done after the Vamanagarma. I will tell you the treatment protocol for psoriasis. Rutshana, Deebana, Padana by Vaishwanara, 3 to 7 days, followed by Snekabana with Aragodabhadiktakradam 7 days, followed by Vamanakarma by Madana, Vaja, Eshti Madhu, Saindava, the yoga already I told you. Then you will be doing the Takradara, then internal Shamana Aushadhi. I will tell you the Shamana Aushadhis also. In psoriasis, the main Shamana Aushadhis we are internally giving Shonidamardam Kashayam. That is the best one to me. Shonidamardam Kashayam, Neeli Tulasyadi Kashayam, Neeli Tulasyadi Kashayam, Tiktaka Kashayam, Aragodadi Kashayam, in some cases Manjishtadi Kashayam. I will repeat once again. Shonidamardam Kashayam available. All medicines are available. Shonidamardam Kashayam, Neeli Tulasyadi Kashayam, Tiktaka Kashayam, Manjishtadi Kashayam. These are the main Kashayam. In certain cases, you can even use Guluchyadi Kashayam. Those who are getting psoriasis plus psoriatic arthritis, it is better to use Guduchyadi Kashayam or Guggulu Tiktaka Kashayam. Psoriasis plus psoriatic arthritis. You need something higher, that is why Guduchyadi, because it's an immunoregulator. You see, the psoriasis is a typical autoimmune disease. So you need something which will control the autoimmune action, and Tinospora cordifolia, Guduji is the best autoimmune controller. That is why Guduji is very much important in such a pathology where there is autoimmune disease. And always we will supply with internal medicine which will be having Rakta Prasadana, Kapashamana and Twaksara Vardhana. The word Twaksara Vardhanam is important. Okay. And this is another psoriasis called Gutte psoriasis. Gutte psoriasis, where usually seen in children and adolescents, rash often appears rapidly and individual lesions are droplets, small droplet lesion. There will not be much bigger lesion. Small droplet lesions without a connecting edge. So that is the Gutte psoriasis. It will not be a spreading psoriasis. Small single droplet type of lesions are there. They will not be that much bigger and they may not be interconnected also. Then pustular psoriasis. This is the psoriasis where you are getting pitta dominant. Generally psoriasis is vata kapha, but in this particular case of pustular psoriasis you are getting palma plantar. You can see the pittaja lesion. It will affect the soul and pyrexia will be invariably here. In palmoplantar psoriasis, there will be always pyrexia, jara will be there. So you can use the pitta shamanam. Then I am widely giving Sharibadi Kashayam. When there is more pitta involvement, Sharibadi Kashayam or even Guduchyadi Kashayam. When there is more Vata Kapha, the previous Kashayams are there. Think about jara chikilsa in pustular psoriasis. We call it as palmoplantar or pustular psoriasis. Okay. Then this is what I told earlier, psoriatic arthropathy. If psoriasis is having nail changes, you can see, and then definitely the patient will have a psoriatic arthritis. Madhu Tailiga Vasti is good. Because psoriatic arthritis is becoming more vata with the joint involvement, you need Vasti. So Madhu Tailiga Vasti, which is indicated both against Kushta and psoriasis, Kushta and Vadarekta. According to me, the psoriatic arthritis is a combination of skin plus joint. So you need Vasti, and the best yoga is Madhu Tailiga Vasti. Madhu Tailiga Vasti is useful against psoriasis as well as psoriatic arthritis. Then urticaria, already we told, these are the typical urticaria picture. The treatment of urticaria, I will tell you, Virejanam is mandatory. Because it is acute cases only. Ashugari, Trivir Churnam 20 gram, Avibatti Churnam 20 gram, Padola Muladi Kashayam 180 ml. 180 ml means the ready Kashayam. So any two pala. 2 palas or 180 ml of what? Padola Muladi Kashayam or 15 to 20 gram of Trivir Churnam, 20 gram of Avibatti Churnam can be given. If the patient is old, he cannot withstand much Virejana, you can give a Kalyana Gula or Trivrt Leha. Kalyana Gula, Trivrt Leha. If the patient is not able to go daily Virejana, you can give a mild purgative like Manibhadra Gula. Manibhadra Gula can be, because Manibhadra Gula contain Dendi, Dravanti, everything is there. So that can also be given. So Trivir Churna, Abhibhatti Churna, Manibhadra Gula, etc. can be given. Internal, you can see, this is called dermatographia. Even you can write in their skin. This is the extreme level of hypersensitivity. Whatever you can write on, if their hypersensitivity is there, no, they can easily pass their examination. Why? You can write all the slogas here only. Because it will not be there for more than half an hour. It will immediately go. It is a transient phenomenon. And the yogas which are indicated in Articaria, Padoladi Kashayam, Padola, Kadirohuni, Chandanam, Madhusrava, Guluji, Padanidam, Nihandi, Kapapitta, Vishamajjuram, Visham, Vami, Arojagam, Kamalam, Padoladi Kashayam, Nimbadi Kashayam, Darvyadi Kashayam, Nimba Rajanyadi Guliga, Rajanyadi Churnam, Haridra Khandam. All these medicines are indicated in Articaria, which is very much similar to our Shita Pitta, Udarda, Koda concept. Padola Muladi Kashayam or Padoladi Kashayam, Nimbadi Kashayam, Darvyadi Kashayam, and even you can think about the Nimba Rajanyadi Churnam, Haridra Khandam. I think you know all these medicine. Yes or no? Haridra being a very good antihistamine drug is widely given in Articaria. That is mandatory. Typical pictures are there. Okay, then lichen planus, another skin condition, lichen planus. You can see this is the typical color. Violaceous papules are there. You can see the typical color of lichen planus. See, this will be the typical color of lichen planus. Pitta Kapham. Pitta Kapham is the main dosha. Aragodadi Kashayam is given. Arkadi Kashayam is given. Virejanam is mandatory. 2 Arishtams are good in such condition. Aragodarishtam plus Khadirarishtam. Now, Arishtams mean 30 ml BD. Aragodarishtam, Khadirarishtam. Any one can be given for a long use if there is more itching. Aragodarishtam or Khadirarishtam. And some people even give Sharibadhyasavam. Sharibadhyasavam is also good. And you can supplement with Arogya Vardhini Vadi. You can supplement with Arogya Vardhini Vadi. Virejanam is mandatory. And sometimes, lichen planus will be affecting the oral mucosa. So when you are getting a lichen planus patient, never forget to examine the oral mucosa. There will be always violaceous spots in the oral cavity. Saptachadadi Gandusham. Gandusham with the Saptachadadi Kashayam is available. That is very good against oral pathologies of the lichen planus. We can see. Typical pictures are there. So Saptachadadi Gandusham can be given for lichen planus. Then impetigo contagiosa, very contagious disease affecting the children especially. It is mainly bacterial only, impetigo, and this is the typical picture caused by Staphylococcus and Streptococcus. Staphylococcus, Streptococcus, typical Kapha Pittajam. You can see Daha, Raga, Pus, all are there. Daha, Raga, Paga, Pus is there, and we prescribe always Nimbadi Kashayam. Nimba is a very good drug because Nimba having potent activity in such a Pittaja condition. Nimbadi Kashayam is given, Guduchyadi Kashayam is given, Nimba Kalka Lebanam. Nimba Kalka, you will make the paste of the Nimba leaf and that is applied externally. Lejjalu Patra Lebanam. Lejjalu, Mimosa podica, that will be converted into a paste and applied externally. So Nimba Kalka Lebanam, Lejjalu Kalka Lebanam, Nimba the Kashayam, Guduchya the Kashayam, etc. are very good. Always stay away. It is a highly contagious disease. So we always recommend to use the Villuadi Guliga. Villuadi Guliga? There is a famous yoga in Agadadandra called Villuadi Guliga that is widely given in toxic condition. And it is supposed to be very good anti-infective. Villusya Moolam Surasasya Pushpama Yoga, and Villuadi Guliga is applied externally. Villuadi Guliga is mixed with Shanka Pushpi Swarasa. Villuadi Guliga mixed with Shanka Pushpi Swarasa applied externally. If you are not getting Shanka Pushpi Swarasa, Villuadi Guliga with Tulasi Patra Swarasa. These two lebanas are extremely beneficiary in conditions where there is infection, and even you can give Villuadi Guliga internally. Villuadi Guliga internally, very famous drug. Then herpes simplex and herpes pathology is very much similar to Visarpa concept in Ayurveda. Very much similar to Visarpa concept, herpetic gingivo stomatitis. You can see the entire lips are becoming swollen and all white spots are there. It is highly contagious and highly viral. And the main kashayam we are giving is Bhunimbadi kashayam. Bhunimbadi kashayam, Nimbadi kashayam, Mahadikta kashayam. Among the three, one is must. And Saptachadadi Gandusham, Tripala Gandusham, application of Pidaka Churna, application of Kalaka Churna. Pidaka Churnam, Kalaka Churnam with honey. And even you can apply ST Churna, means ST Madhu Churna, less quantity. Don't give more ST Churna, it will cause vomiting. Because ST Madhu is a Vamanobaga drug. So Pidaka Churnam, Kalaka Churnam external. This Gandusha with the Saptachadadi Gandusha, Tripala Gandusha, and internally Mahadikta Kashayam. These are the main medicines we are giving. Herpes simple, as you very well know, it is highly contagious. Pitta Shamana Chikilsa, Visarpa concept is applied because it is very fastly spreading. So we apply with Visarpa Chikilsa only. And herpes in genitals and eye. In genital area and eye also, they are generally Pitta dominant conditions only. In eye, we will use the Lodradi Churna Dhara. Normally, we will make Lodradi Churna in milk because Pitta Shamanam is best with the milk, Kshira. So instead of Kashaya, we boil Lodra with the milk and that will be applied as Netra Dhara. And internally, Shadavariyadi Kashayam or Shadavari Chinnaruhadi Kashayam. Both are Pitta Shamana. So extreme Pitta Shamana Chikilsas are given in herpes in genitals and eyes. This is what I am telling. Visarpa spectrum, quick spreading, Rekta Kleda, and deeper Dadus are involved. If Visarpa is not controlled, that will be leading to further pathologies in the kidney. So what we are doing, we will be doing periodical, episodical Virejana. See, the deep Dadu involvement can be minimized by proper Shodhana. So you can do Virejana with preferably Avibhatti Churna or Kalyana Gulam. Kalyana Gulam is a safe Virejana yoga, 15 to 20 gram. I am repeating, Kalyana Gulam, 15 to 20 gram once in a week is mandatory in such a chronic disease to prevent the deep dhadu involvement. You know, the logic of Shuddhi is it will prevent the deep samprapti. Buddhi prasadam belamindriyanam dhadu stirattam jwalanasya deepti Chiracha pagam vaisakarodi samshodhanam samyak ubasyamanam. A well administered shodhana will minimize the deep cellular kledam. Abhyantara cellular kleda can be minimized by episodical shodhana. So try to give once in a week shodhana with any one of this drug because that will prevent the deep dhadu involvement. That is very much important in diseases like Visarpa. Fungal infection already we have discussed. Tinea ringworm infection already we discussed. Tinea cruris we are widely getting in children, school going children because the sweating is there, and we will be always using the Kimsuga Patradi Thailam. Kimsuga Patradi Thailam externally, Eladi Churnam externally, and Lodradi Churnam externally, Panchaganda Churnam. And any one of these yoga can be applied externally. Internally, you can give a Nimbadi Kashayam. Again, you can see this is the typical area where more fungal infections are there. Kimsuga Patradi Thailam is best in my practice. Tinea corporis, Gudapagam or Gudakuttakam, something like that we can call the reddish area in the buttock region, especially in children. We do dhara with the ST plus Haridra. ST plus Haridra will be boiled, ST plus Haridra, and that will be used as a dhara. And best another dhara is Nimba leaf plus Haridra. Nimba leaf plus Haridra will be boiled and that will be used as a dhara. And externally you can apply Nalpamaradi Thailam. Nalpamaradi Thailam available as Panchavalka Thailam. Both are same only. Pitta Shamana. Parandhyadi Keram. You know Parandhi. Parandhi means Ixora. The red flower, no Ixora. It is available no here. Ixora flower, the red color wala flower. In Malayalam it is Chetti. A bunch like an inflorescence only. Red color, Ixora. You can search everywhere it is available, and that is called Parandhi. It is available. Parandhyadi Keram. Parandhyadi Keram is available to all the companies. So that is a yoga good against such a fungal infection. Then Tinea barbae, again yet another case of ringworm infection. And in such conditions of Kunaga, we call it as Kunaga, nail pathology, we will be always using the Jatyadigratam externally, Chakra Thailam. Chakradailam, Rasottamadilebam. Rasottamadilebam is a very good medicine. Rasottamadilebam, just before applying the Rasottamadileba, you can make the local Shuddhi by any one of the Kashaya Rasa Dhara, something like that, and internally give Aragodadi Kashayam. Aragodadi Kashayam is very good internally, externally Rasottamadilebam, and even Jatyadailam you can use. Then investigation, I think you know. You have to do some investigations. Here, bacteriological studies are the important thing. Mycological studies in fungal infection. Allergy test, very much mandatory. Biological test, serological, hematological, stool examination, urine, histological study, and even rarely in psoriasis to psoriatic arthritis, you need some studies with the joints. So sometimes you need even X-ray also. And these are the allergy tests. Everybody know, used to find out the exact reason for the allergy. Allergic tests are selected on the basis of correct history and clinical observation. Whenever there is an allergy related pathology, give internal Snehabana. My best experiences are with the Snehabana only. Internal Snehabana for a limited period, followed by Rasayana is mandatory for allergy. Never treat allergy with a simple tablet or an ointment. Classical Ayurveda is never ointment chikitsa. Classical Ayurveda is internal purification treatment only. You cannot treat by an ointment, you cannot treat by a shampoo, you need internal purification. So always do Snekabana, Shodhana, Rasayana. Never forget the triple concept. Snekabana, Shodhana, Rasayana in all chronic skin and hair pathology, that is must, especially in allergy. And you know the patch test how we are doing, done in case of contact dermatitis to establish the etiological agent. This is the picture. And you will apply the allergic substance if there is only redness plus. If there is marked redness and swelling, plus plus. If marked redness, swelling and macules, triple plus. If redness, edema and vesicles, 4 plus. Accordingly, we grade the allergy test. Whatever the patient is telling in the history, you will do the allergy test accordingly. And then you see what is the response after applying the allergic antigen. And depending upon the features, you will grade +1, +2, +3, +4, and that will help you how to identify the cause behind the allergy. That is called allergic test or patch test. Now the last part, actually I told so many things. I will summarize the entire management principle once again for your better understanding. Don't worry, this should be in your mind. Now I think your mind is somewhat cultured to absorb Ayurvedic classicals. Am I right? Yes or no? Because you know what is Kleda, what is Rekta, what is Tushti, what is Shuddhi. So now you are ready. Now I am telling Dhatvagni Deepana. Very serious things now we are discussing. Dhatvagni Deepana means the skin pigmentation, the vascular controlling factors, everything is coming under this. We talk about Rekta Sara, we talk about Tvak Sara. Rekta Sara is vascularity. The complexion of the skin is simply due to the vascularity. So when we discuss about Dhatvagni Deepana, we mean how the hormones, how the enzymes, how the pigments are helping to make your skin healthy in a very positive way. Kleda Shamana. The word Kleda means any toxin, bacteriological or anything related with your diet which will cause a problem of ama in Rekta. A single word ama in Rekta is very much similar to Kleda. Are you getting me? You understand ama very well, no? If you feel the same ama in the Rekta, the terminology better is Kleda. If the ama which is present in the Koshta is behaving in the Rekta in the same way, the good terminology will be Kleda. Now I will tell you one more line. Sharpen your brain. Sharpen your brain. Ama in Koshta is equal to Kleda in Rekta is equal to Abhishyanda in Netra is equal to Shobha in Sandhi is equal to. Now I don't know remaining. Just follow me. Follow me. It is not the time to clap. Follow me. Ama in Koshta, understand, visualize, is pathologically equal to Kleda in Rekta. Diabetes mellitus. Kleda in Rekta is equal to Abhishyanda in Netra. All vascular disease in eye. Abhishyanda in Netra is equal to Shobha in the Sandhi. All the 4 need Avatarpana Chikitsa only. Am I right? Yes or no? This should be your internal yes, not the lingual yes. Because when there is ama, the treatment is Langana only. When there is kleda, increase of glucose in the body, Langana only, Vyayama, diabetics, dieting. When there is an abhishanda in the eye, congestion in the eye, externally Lebana and everything will be reduce the fluid, Langana only. When there is swelling in the knee joint, Shobha, no oil, Lebana, again Langana only. Are you getting me? In the contemporary scenario, most of the lifestyle disorders are due to the accumulation of metabolic waste. We call it as dhadu mala sanchayam. Are you getting me? That is why most of the time dhadu mala sanchaya related diseases need periodical, episodical shodhana. That is why Ayurveda told tatra alpe langanam padhyam madhye langana pajanam prabhude shodhanam tadhi mulad unmulayen malan. When you are doing the periodical shodhana, you are not allowing the cell to get more accumulation of metabolic waste. What do you mean by shodhana? Shodhana is not vomiting. Shodhana is not sitting in the toilet. Shodhana is the cellular level purification. I repeat, Shodhana is the cellular level of purification where each cells are communicating in a better way. When two cells are communicating without any obstruction, we are telling it as Srodho Shuddhi. When my neuron is commanding my nephron is obeying the neuron, that is the best anilomata. Are you getting me? It is not simply you are vomiting, you are going to the toilet. No. The cell-to-cell communication, within the cell communication, intercellular communication, intracellular communication, that is Srodho Shuddhi. There is nothing beyond this. So when you do Shodhana, you are removing all the positive, all the probable stress. You are removing all the probable resistance to the cell, and by which the cell will become more sensitive. The cell will become more ready. The cell will become more receiving. The cell will be more receptive. So when you remove a kleda, glucose will easily be attacked by insulin, converted into glycogen. Otherwise, there is resistance. So removing the kleda, removing the ama, removing the abhishanda, removing the shobha is nothing other than Srodho Shuddhi. In all chronic skin disease, you need kleda shamana. So what we are doing, we will be doing once in a week or once in 15 days, a periodical shodhana is mandatory. You will give a tuvaraga rasayana, baguji rasayana, anyone as a preparatory rasayana for preventing further complication. Tuvaraga rasayana and baguji. You know what is baguji? Soralia corlifolia. And Soralia corlifolia is typically given against autoimmune induced psoriatic pathology. And Tuvaraga Thailam is causing Vamana and Virejana both. So a rasayana mentioned in skin disease is Tuvaraga. That is also Vamana and Virejana in nature. That is why we always tell you need periodical, episodical mala nirkarana from each cell by which the cells are kept ready for better performance is called Dhadu Shuddhi. So Dhadu Shuddhi means the cell will not be having any accumulation of any metabolic waste that is there. Then finally Kleda Shuddhi will lead to Rakta Shuddhi. Ama Padana to Agni, Kleda Shuddhi. Toksara means the pigmentation plus vascularity of the skin. Toksara means the pigmentation plus vascularity, and we are always giving the medicine. Finally, they will empower the Prajaga Pittam. You know, Prajaga Pittam we are discussing in the concept of fundamental. That is nothing other than vascularity of the skin only. So every medicine in the dermatology will ultimately do this. Now, if your fundamentals are clear, you write that ahara, select that vihara, and tell to take that particular aushadha, which will do all these four things in your patient. 4 in 1. Dhadu Agni Deepana, Kleda Shamana, Rakta Shuddhi Karne Wala, Twaksara Vardhana Karne Wala, koi bhi drug ho, diet ho, drink ho, that is best against skin disease and hair disease. That is the conclusion. So you will do Snehana, Shodhana, Shamana, Rasayana. First treatment in Kushta is Snehapana. Kushtinam Snehapanena Purvam Sarva Mupachared. Mandatory. Kushtinam Snehapanena Purvam Sarva Mupachared, because remission and relapse can be prevented by Snehana only. Okay. Then these are the yoga. I will conclude again. Tiktaga Grida. This is for your easy understanding. Tiktaga Grida in Pittaja spectrum, vascular spectrum. Mahadikta Girdam, the same level with upgrading. Araggoda Mahadiktakam, Kapha plus Pitta, psoriatic spectrum, Vijarchiga spectrum, eczema spectrum, Guggulu Tiktakam, autoimmune spectrum, psoriasis with psoriatic arthritis, Tripalagradam, general Tridosha Shamanam and pathology related with Koshta, Padoladagradam, very good yoga against Pitta Dushti, like palmoplantar psoriasis, any condition where there is more Pitta Dushti, Padoladagradam, Madhu Yashtyadi Tailam, the best oil which will work against vascular endothelial dysfunction. Listen the word. Madhuyashtyadi Thailam is mentioned in Vadarekta Chikilsa where there is Rektavrta Vada. And Madhuyashtyadi Thailam is found to be effective in VED, vascular endothelial dysfunction. You know what is endothelium? Endothelium is the innermost layer of the blood vessel. Endothelium is the innermost layer of the blood vessel. Any continuous damage to the endothelium will be leading to a secretory problem to the concerned blood vessel. And secretory problem to the concerned blood vessel is called Sravanad Srodamsi. We study Srodas, Sravana, Srodamsi. We never understand. To us, what is Srodas? A tube through which something is flowing. No, that is partially correct. Srodas will secrete. Where? You go to the modern understanding of endothelium. Endothelium will be secreting so many chemicals which will keep the endothelial thickening either normal or abnormal. How much a blood vessel is to be dilated, how much is to be contracted is decided by a chemical secreted from the innermost layer of the blood vessel called endothelium. And endothelial dysfunction go correct karne walo dawa mein acha hai to Madhuyashtyadi. The best medicine in my experience. That is why Burgess disease. You know TAO. What is TAO? Very good. Thromboangina obliterans, smoker's disease, the Burgess disease, and all such vascular pathology, even varicosity conditions where the innermost layer of the blood vessels are affected. The primary thaila is Madhuyashtyadi Thailam. I would like to recommend you to read again Vadarekta Chikilsa, Rektavrta Chikilsa, and Madhuyashtyadi Thailam is having 4 prayoga: Pana, Anuvasana, Abhyanga, Vasti. It can be given Pana, Anuvasana, Nasya and Abhyanga. Internally given, Vasti you can give, and even it can be used for Nasya also, and even externally. See, Pana, Anuvasana, Nasya, Abhyanga, Prayuktam, Chadurta Megadaha, that is Madhuyashtyadi Thailam, Rektavrta Vadam. Then Svedana, everybody already told, Sthira Kadina Mandala Kushtanam Svedanam. Sthira means raised pathology, Kadina means hard pathology, Mandala means circular pathology. You can give. I have a simple example for you. When you are getting raised skin lesion like a wart, you are having wart something, we will take a lesuna, the lesuna converted into a what? Kalka, and shigru bark, and haldi means haridra, and that will be made into a small potally, and that will be heated and rubbed in the water daily. Day by day it will become soft and finally shedding off. So that is the logic told in Ayurveda. Sthira Kadina Mandalanam Kushtanam Potalair Hidasveda. This potali is prepared by haldi plus lesuna plus shigru. That is also mentioned in our science only. Then Vamana Virejana we already discussed. This is the yoga which I told previously. Do you remember? Madana Pippali 2.5 gram, Vaja 5 gram, ST Madhu 7.5 gram, Saindava 10 gram, Madhu required quantity. This is the normal Vamana yoga we used without any complication for the last so many years. The patient already we have seen. Then the common Virejana yoga we are giving in the practice. Trivart Leha, everybody know 15 to 20 gram. Trivart Leha. Avivatti Churna 15 to 20 gram with honey only. Kalyana Gula 15 to 20 gram. And Ichhabedi Rasa, a very good practical drug. You can give 1 to 2 tablet with drasha juice. Ichhabedi Rasa can be given 1 to 2 tablet with draksha juice, grapes juice. That is a very good Virejana drug. Any one drug depending upon your convenience you can prescribe for your practice. And Jaluga Avtarana is always mandatory. I told you, any vascular condition we regularly do in our OPD. I have a definite protocol of Jaluga Avtarana. If there is a Pitta Rekta Dushti, I will make a plan. If there is a Pitta Rekta Dushti, the plan is like this only. we will first do Snehapana with the best Pitta Hara Grida, Tikta Gridam. See, again I am coming to Tikta Grida only, no? Huh? Not purposefully, automatically. So when there is a Pitta Rekta Dushti, we will be giving Snehapana with Tikta Grida. Then we will automatically go for a Shodhana by Avibhatti Churna Kalyana Gula. Then only do Rekta Mokshana. Without clearing Pitta, don't go for Rekta. The local Rekta Dushti can be done by a Rekta Mokshana, but the systemic pathology can be corrected only by the previous Pitta Dushti. So point is very simple. Dosha Shuddhi karne ke baad hi Thad Shuddhi karna. पित्त शुद्धि करने के बाद ही रक्त शुद्धि करना. पित्त शुद्धि के लिए क्या करना चाहिए? स्नेहवान करना. स्नेहवान के लिए तिक्तगम देना, उसके बाद अभिवत्ति देना. अच्छी तरह शोधन मिलने के बाद ही रक्त मोशन के बारे में सोचना. एंड दैट इज व्हाई वी ऑलवेज कीप जलूगा आफ्टर द घृतपाना विरेचना and you know what is the logic? The saliva of the jaluga contains so many chemicals. More than 15 chemicals have been identified by the modern scientists. The chemicals, and most of them are vasodilatory, thrombolytic, analgesic. You know, it contains hyaluronic acid, betadine is there, destabilis is there, hirudin is there. All these chemicals are vasodilatory. You know, nobody will feed jaluga. Are you feeding jaluga? So, Bhagavan ने उसको वरदान दिया. See, आपकी सलेवा में hyaluronic acid है. When there is hyaluronic acid, it will keep the vessel dilated. And it destabilis will do thrombolysis. So when Jaluga comes and bites Mr. Gopakumar will never know the pain because it contains analgesic. And whatever blood is there in Gopakumar's body will fully flow into the site because of vasodilatation. And even though Gopakumar is having a block, thrombolysis by Betlin. So 3 in 1, everything will come to that, and Jaluga kushi se pita hai. He will drink it like a Dracula, and when he is getting full of stomach only, he will be coming down. No? So that is the logic. When you keep Jaluga in a site, it will remove the local circulatory stagnation. That is why we do Jaluga Avadana in chronic non-healing diabetic ulcer. In chronic non-healing diabetic ulcer, if you keep Jaluga, it will remove the local cellular debris and it will clear the circulation. Better the circulation, better the healing. Vrana Shuddhi, Vrana Roban. They will always run together. Vrana Shuddhi and Vrana Roban. So always try to do Jaluga Avadana. Jaluga Avadana is the safest one in the daily practice. You can see. And finally, I think you are doing regularly. And finally, you can sprinkle. First you wash the Jaluga, you apply in the site, you apply a cotton, soaked wet cotton to make it. So because Jaluga should feel that he is comfortable. He should not feel that Gopakumar is catching him. So when you apply some cotton wool and dip in the water, you cover on the top of the Jaluga, he will feel that still he is in the pond. So he will drink very happily. Okay? And then finally he will become very big. And then you sprinkle some Saindava or Haldi powder, and he will vomit the entire blood and wash it. Otherwise, he will get the Indramadam. Actually, you are cheating the Jaluga, no? You are offering something, the poor will drink, and finally he will cheat. And when we are cheating the Jaluga, we will tell, आपके लिए ही किया है, नहीं तो आपकी मृत्यु होगी. ऐसा बोलता है. So that is what we are doing in Jaluga. You know, that is the logic why Lord Dhanvantari carried Jaluga. No, he could have carried on anaconda, no? He could have carried on anaconda, beda anaconda, Amazon hai na, Brazil mein. Madam, you are from Brazil only, no? So he could have carried on big anaconda there because Lord Shiva is having king cobra. So he could have selected a big anaconda, but he selected a very small creature because he knows the value of this Jaluga. That is Jalam Asam Ayurvedi Jaluga. Jalam Asam Ayurvedi Jaluga, like that only. Okay. So when once in a seminar I told the same thing. I told, no, being the Lord Vishnu, he could have carried an anaconda, but he selected a Jaluga. Some hardcore Vishnu Bhaktas were there in the hall. They told, you don't know, sir, our Lord Vishnu is sleeping on a snake only. Then I told, I am coming from that place only, Thiruvananthapuram. You know, my place is Trivandrum, the Ananda Padmanabha. Very good, like that only. So that is why the value of life is very much important. Value of life is very much important. So this is Again, you can see Jalavagavadana different stages. In any place you can apply. Everywhere, especially in the lower limb where there is gravitational impact is there, more ischemia will be there, and it's a very good treatment. You can do regularly without any complication, cost effective. Then we do regularly prachana. Prachana means pricking, and especially you can see before doing prachana also you have to do the very good snegabana, because rektamosha will lead to some type of blood loss. So दाद शुद्धि दाद शोषण नहीं होना चाहिए, इसलिए आपको बीच बीच में घृत देना पड़ेगा. So prachana is a technique of bloodletting therapy by pricking in particular manner. Particular manner means we will start from downwards to upwards, and you will not prick on the same site again. And before that, enough snegabana should be given. Mainly we are giving in folliculitis and such a pathology. You see the picture, the more light is coming to that. That is, otherwise you can see. The blood will be coming like this only. Localized rectadushti, local eczema, local venous thrombosis, thick and numbskin lesions, pyoderma, alopecia. Alopecia aerata. Alopecia aerata, we regularly do prachana. And the thing is, while doing prachana, you have to make the early preparation very well. Enough snegabana should be done, gridabana should be done, and pricking, don't prick on the same side, prick in an oblique manner, starting from the downwards to upwards. Otherwise what will happen? You will again, if you are pricking in the up to down, what will happen? Use your common sense. The blood will be flowing, you cannot see where to prick again. So from down to up you can start the pricking, and it should be in an oblique way. And after pricking it, you can see, and before that, if this is the area for prachana, you make a bandage in the upside to make the blood flow here, and then do the pricking using a scalpel, and you can see very good blood will come. See, I think this picture is very clear. Obliquely we are pricking, and we are getting, and wash with the triphala kashayam. We regularly do in our OPD, wash with the triphala kashayam and apply durvagridam. You know, apply very thick leba, it may cause further inflammation. So mild durvadi leba. First prachana, then chalana by triphala kashaya. After the bleeding stopped, you just apply the durvagrida, make a light bandage with a light bandage, and give internally skin prasadagara drug, rekta prasadagara drug internally. That is the treatment protocol for prachana. Periodical shodhana is needed. Then payadikrama is must after shodhana in kushta. In my opinion, we don't give much diet regulation after the shodhana, but you give selected Ayurveda, say for example, select Aragoda Majja. Aragoda Majja or Khadira, etc. can be used for preparing food. There is a reference in Ayurveda, Pana Bhojaneshu Khadirodagam. You know, Khadira can be prepared as a paniya in which you cook the rice. So for Pana Bhojana, select Khadira, Aragoda like skin-friendly, diet-friendly Payadi drugs. Then only, what is the logic of Payadikrama? Payadikrama doesn't mean that it is a simple Agni Vardhana therapy. No. Actually, what is Payadikrama? Payadikrama means you are gradually shifting from Lagu to Guru. You are shifting from means carbohydrate diet to protein diet. First 2-3 days paya means kanji, rice. Then you are going to yusha. Yusha means protein. So glucose to protein, light to heavy, empowering the Agni gradually. That is payadikramam. Samshodhana astra visrava snehayodhana lankhanaihi yatyagnir mandadam tasmat kramam payadi majared. Samshodhana astra visrava lankana etc. will bring down the Agni. So gradually empower the Agni using the Payadikrama. So that is very much important. Select Kushtahara herbal drugs to prepare Pana, Leba, Bhoja after the Shodhana Karma. That is important. Some studies in my college, some Eka Aushadhis are found to be effective in treating external lesions of psoriasis. They can be applied as Lebana, Haridra, Nimba, Amrudu. Amrudu means Guduji. Dandapala, I think you know, Vitpala. The leaf of which will be kept in the oil, and the oil will turn red in color. I think you very well know. Vitpala Thailam, Ayyapala Thailam, the name, it is very famous. These are some of the medicine. Then common yogas, you know, Wrightia tinctoria. The botanical name of the drug is Wrightia tinctora. The Malayalam name is Vitpala. It is available in all Kerala company. You just search Wrightia tinctoria. You take the leaves, you take the leaf and dip in the coconut oil, keep in the sunlight. I am telling how to prepare the oil. Take the leaf, dip in the coconut oil, keep in the sunlight, you will get the oil. You need not cook it, you need not prepare it. The yoga is called, the drug is called Raitia tinctoria. And now these are the common yogas I will tell you. Neeli Tulasyadi Yogam, that may be a rare one. Neeli Tulasyadi with Villuadi Guliga is indicated in all infective skin disease, because it is a Vishahara yoga. Neeli Tulasyadi with Villuadi Guliga. Padoladi is mainly indicated in Pitta Samana. Padoladi Kashayam plus Nimbarjanyadi Guliga. Padoladi Kashayam, Nimbarjanyadi Guliga, Sharibadhyasavam, same prescription. Then Shonidamradam Kashayam, again in psoriasis only, mainly Vadaka Samanam. Aragodadi Kashayam still indicated in Kapha dominant itching stage with more Kaphadikam. And Tiktagam and Mahaditakam already we discussed. Okay. Kaishora Gugulu, Arogya Vardhani Vadi, Chandraprabha Vadi, Manipadragulam. Chandraprabha Vadi is a very good drug where there is Dhadu Shuddhi needed, because it contains Shilajadu. Shilajadu is the best vascular protective drug. A microangiopathy, macroangiopathy, prameha, hypothyroidism, circulatory problem, skin disease. You think about Chandraprabha Vadi. I repeat, a type 2 diabetes mellitus, vascular insufficiency with a skin pathology, Chandraprabha Vadi, Shilajadu Vadi, Shilajadu Phasmam, and Shiva Guliga. Anyone can be given internally. Then Kushtahara Ganabai Charaga, Nishottamadi Kashayam, another yoga which is mentioned in the classic Nishottama. Nisha means again Haridra, Uttama means Tripala. So Nishottamadi Kashayam, Saptasama Guliga, Gandhaga Rasayanam, etc. are the other options which can be given in different conditions as per dosha domination. This already we discussed, Dushi Visha Guliga. I think we started with the Dushi Visha only. Then external application, Thailas are preferred because Vata Kapha, Eladi Thailam, Guggulu Marichadi Thailam, Vajraga Thailam. Dear ones, this is important. Vajraga Thailam is very much indicated when there is a hard, rough, black lesion. We call it as Kidiva Gushtam. Hard, rough, black lesions are there. Vajraga, because it will make the lesion very soft. After 1 week of administration, the lesion will become very smooth and mrudu. So Vajragam and Neeli Daladi already we discussed. So these are the main external yogas given. Takradhara already we have discussed. Takra is Vadakabhagara. Takra is Rodho Shuddhigara. Takradhara can prevent proliferation of cells, enhances Twaksarada. Takradhara reduces stress. Then Rasayana we already discussed. 3 main Rasayanas in psoriasis. Triphala Rasayana, Baguji Rasayana, Tuvaraga Rasayana. You know how we are giving Baguji? You take 15 gram of Baguji as a powder. You keep it in buttermilk overnight. Next day you churn it and remove the drug debris and take that takra internally. So keep Baguji Churnam 15 gram in takra overnight. Next day morning churn it and remove the debris and give the takra internally. Takram tadeva anu pibandi chande. That is the reference. So that is indicated in psoriasis. Then nail pathology we already discussed. Shuddha Roga Jagilsa, Kunaka Jagilsa, Jatya Degrada, Chakradaila, Pindadaila. Chakradaila, Pindadaila, Resotama Dileba. Already we discussed. Then another yoga which we are having some study in my college. Amalagi, these are some researchers in my college, Trivandrum. Amalagi, Baguji, Chitraga, Pippali, Vidanga, Mandura. The yoga is called Sasangalekha. 6 gram with 12 ml of Tiladaila morning and evening before food, 45 days. This is a very good Rasayana Prayoga. It is mentioned in the textbook. All the drugs are available. Sasangalega, Amalagi, Baguji, Chitraga, Pippali, etc. can be given. Can be given for 45 days. That is good against erythema, scaling, induration improved, area reduced, more effective on the head. Scalp psoriasis, it is what I am telling, since we are having hair pathologies also, more effect on the head. This is more applicable when there is a hair pathology with alopecia areata with psoriasis. Then comparative study of Guggulu Marijadi and Vidpala Thailam. This Vidpala only I told you. I told about a plant called Raitia tinctoria, no? So that is the Vidpala. So external application of 4 weeks, twice daily, both have a Tridoshakana property and equally effective. These are the 2 yoga which we generally give for external application, Guggulu Marijadi Thailam and Vitpala Tailam. Then Tuvaraga Rasayana, already the very drastic Rasayana which will make Vamana Virejana together. So give only to the strength person. Don't give to the weak patients. After proper Shodhana, 10 ml Tuvaraga Taila with half glass milk early morning. Duration 5 days. Vomiting and purgation occurred during these days. Food told by Yavagu without salt. Never give, cold Yavagu without salt. That should be given. Peya and Mudga Suba is given. Khadira Siddha 5 ml for 1 month as Shamana. Both are effective in reducing the signs and symptoms. So a very good Rasayana Tuvaraga Tailam. That has done so many studies in our department. Then Vishakina Deshemani. Some traditional prayogas in Kerala, I will tell you. Some traditional Kerala prayoga. Traditional prayoga, mainly we are applying Haridagi in Gomutra. You rub Haridagi in Gomutra, apply in any Kapaja skin disease. Kapaja skin disease means where there is more raised circular elevated lesion. If it is difficult to get the Gomutra, Haridagi can be used with Dhanyamla. Haridagi can be made in the paste with Dhanyamla. That is very good in preventing or reducing the complaint. And Shariba. You know, Shariba means Hemidesmus indicus. That is a very good drug in combination with the Padola. So Padola plus Shariba will be given as a Kashaya, and that is very good against childhood infant skin disorder which are having some contagious nature. Padola plus Shariba. And again we always use the Kushta and Chakramarda. You know, Kushta and Chakramarda, a local plant that is good against fungal infection. So these are the local prayoga which we generally do. Shanga Pushpi Swarasa. Shanga Pushpi Swarasa is applied against all insect bite or anything like that only. Shanga Pushpi Swarasa plus Vilwadi Guliga, a best combination against abscess. Shanga Pushpi Swarasa plus Vilwadi Guliga, best combination against abscess. These are some local prayoga which we generally do. Already we discussed Panchakarma, discussed Vamana Karma in trichology we already discussed. Virejana also we discussed. Then best Snehana drug, again Jeevaniya Grida is good against hair pathology. If you are getting a autoimmune disease and hair loss, Jeevaniya Grida is good because Jeevaniya Grida is good against immune correction. Then Panchadittagam, Tiktagam, Pittashamanam, Padoladi, Kosta plus Shaga together, and Jeevaniyam when there is an autoimmune. SLE Valongo Ata hai hair loss. You know SLE, what is SLE? Systemic lupus erythematosus, and they will be getting massive hair loss. Photophobia will be there. Dadugada Atyagni is autoimmune disease. Dadugada Atyagni. Dadugada Mandagni we know. But Dadugada Atyagni will destroy the cell and the cells will be naturally killed. We call it as autoimmune. In SLE, you are getting multi-system autoimmune problem. So there will be photophobia will be there will be hair fall will be there, irritability will be there, menstrual anomaly will be there. In such a condition also, this is very important. You can think about Jeevaniya Gridam. Jeevaniya Gridam is a very good combination concerned with autoimmune pathologies and hair loss. Example, psoriasis and SLE. These two diseases you are getting hair loss and the Pitta Prakopa. Dhadugada Atyagni is autoimmune disease. This already we have discussed. Murdini Taila in trichology, I told you. Chandanadi Tailam, Kshirabala Tailam, Himasagara Tailam, Pittam. Chandanadi Tailam, Himasagara Tailam, Shira Tailam, Pitta Shamanam. How you will identify Pitta? It will be having coppery red hair with all problems of Tamravarna and every condition where there can be hypertemperature or even Pitta Sandabam, Pitta Shirastabam, Pitta Adiga Shirasula. All these things are Himasagaram, Chandanadi and Kshirabala. And when there is more heaviness is there, and when you are having the discharge etc., do Chalana, do Lepana, then go for Kapashamanam. The best Kapashamana oil for the head is Karpasastyadi. The best Kapashamana oil for the head is Karpasastyadi. And finally, brittle, dry and thin and nourishing problem to the hair, Vadigam, Dhanvantaran Tailam, Narayana Tailam, Vadashani Tailam. Dhanvantaran Tailam, Narayani Tailam, Vadashani Tailam. These are the main Murdini Tailas in trichology. Shirodhara we have already discussed. Shirovasti is the same. And when you do Shirovasti, the ideal time is afternoon. And शिरोवस्ती करने के बाद नस्य करना अच्छा होगा, क्योंकि शिरोवस्ती के बाद इतना उल्क्लेश आता है. So you will be getting Krana Vaktra Gudasrava. If it is a very good Shirovasti, the Krana discharge will be there. To remove it, you do Nasya. In my opinion, Shadbindu Tailam is the good Nasya for hair. Shadbindu Tailam. Shadbindu Tailam is the good Nasya Yoga, which is very good against Srodo Shuddhigara. And you very well know, nose communicates to brain through cribriform plate of ethmoids. Nose communicates with the eye, nasolacrimal duct. Nose communicates with the ear, eustachian tube. That is why Sringadaka Marma. So the concept of Sringadaka Marma is very well important. So do Shirovasti, and after doing the Shirovasti to remove the remnant dosha, you can think about the Nasya. Shadbindu Tailam is good. And if there is more migraine, people are having migraine and that much of Shirashula, Varanadi Chidagradam is good. Varanadi Chidagradam is used for Nasya. I am telling about Nasya only. Varanadi Chidagradam Nasya in migraine, Shadbindu Taila in hair pathology. If there is a hair problem, do Shirovasti followed by Nasya. Because Shirovasti से क्या मिलता है, इतना उल्क्लेश बाहर आता है, उनको बाहर करने के लिए it is better to go for Nasya. See the beautiful concept about Nasya, the maximum transnasal drug delivery is done by Nasya. That is the word used by the modern pharmacologists. Transnasal drug delivery system. You know the nasal mucosa is highly absorptive. The upper 2/3 and lower 1/3 is highly absorptive, and that is why nasal mucosa takes the medicine with a higher concentration even compared to intravascular routes. There was a study, listen carefully, there was a study by University of Iceland. They have done a medicine for the dementia, that is Alzheimer's. They applied the medicine orally, they gave the medicine intravascularly, and they gave the medicine transnasal. And by binding with the radioisotope, they measured the brain uptake of each route. Are you getting me? They measured the quantity of medicine taken by the brain after binding with an isotope, and they could see that maximum absorption to the brain was through the transnasal routes, even compared to intravascular. That may be the reason Ayurveda told Urda Jatra Vigareshu Vishesha Nasya Mishyade Nasahi Shirasa. That he is important, not she. Nasahi Shirasa Doram Tena Tat Vyapya Handidan. The nose itself is the entrance to the brain, so that is can be given. So Nasahi Shirasodar. And when you come to the benefit of Nasya, clearly he is telling Kanonada Prasannatta Skanda Griva Asya Vashasa Dridendriyastu Apalito Palitam Apalitam. No, when he is telling the beauty of Nasya, the last word is trichology only. Dridendriyastu Apalito Bhaveyur Nasya Shilina. So what I am doing in my practice, I will tell the patients to repeat the Nasyas Pradimarsha in the remaining course. In the clinic, you may be doing for 7 days. Then you will tell the patient to repeat the same with the 2 draws for the next 14 days. That is called Pradimarsham. In my experience, Pradimarsha Nasya is very important. You know why? Because patient will take that much care to do his own Nasya. So they will do Nasya for next 21 days, 2 draws. That is very good important, very good effective, and that will be having very good importance. So Marsha Nasya followed by Pradimarsha is very good in hair pathology, though Shirovasti. So my point is Shirovasti do first, then do the Nasya. Then Shiropiju. Shiropiju is especially effective in the fungal infection, certain kinds of Darunagam beetle, or we are using the Shiropiju with Eladikeram, Manjishtadi Thailam. Eladikeram, Manjishtadi Thailam is very good against the continuous itching. We call it as Darunagam. Kanguk, Siddhartha Ganipa, small pidagas will be there with the itching. So such conditions, especially for children, school-going children, you can shave the head and use the Shiropiju with Malatyadi Thailam. You know, Malatyadi Thailam is available. That is a good yoga against even krimi. According to Ayurveda, one beautiful concept is there. Every skin disease will be having a 4-fold pathology. Sarva kushtani sa vadani sa pittani sa kapani sa rektani sa krimini bhavanti. Over. Susruta is the final. What is the batting in the last overs called? Okay. Cricketer is there, no? Okay. Finisher only. So he never gave any opportunity any charaga vagbada. When Suvidha comes to bed, he will win the match. So he is telling, Sarva Kushtani sa Vadani sa Pittani sa Kafani sa Krimini sa Rektani. Nothing more. So that is why to treat Krimi, the best medicine again in the head is Malatyadi Tailam. Malatyadi Tailam, Dardura Patradi Tailam, Nimbadi. Any one is good against Darunaga, an infective skin disease affecting the hair. That is widely seen in children. Then Shirobhenga, same Takradara we already told. Kashaya Dara, that is the one important area. Then we will come to the last slides. See, you don't worry, I will take only less than 5 minutes. 1 ton hona, you can count 5 into 30, 5 into 60, 300. I will be telling thank you, don't worry. It is automatically programmed. Okay. No, not like that. So what I am telling, Kashaya Dara, the most important thing is Kashaya prepared with certain selected drugs, especially Shirisha. You know Shirisha? Shirisha Tok. That is an excellent drug for Kashaya Dara in most of the Pitta Kapha Pradhana hair disease. Pitta Kapha Pradhana means when there is more itching, when there is more foul smelling, when there is a discharge or something like that, dandruff, etc. Shirisha Tok Kashaya Dara. Shirisha means very good drug for Bisha, very good drug for itching. So Shirisha Tok Kashaya Dara, I regularly practice in Pitta Kapha hair pathologies and even scalp pathology. Not only hair pathology, scalp pathology also same. Shirisha Tok is available. There is no adulterant. You can easily do. And even you can do Dhara with Parandi. I told you earlier. Parandi Tok, that is also very good. Lodra Tok, that is also very important. And even rarely you can use the Dhara with Manjishtadi Kashaya. That is also given in. But Manjishtadi is more in Pitta Rekta. But Lodram is in Kapha Shamanam and Shirisham is also Kapha Pitta Shamanam. Kshiradhara rarely we are doing except in condition where there is hypertension, etc. But in skin disorders we are rarely doing. Nasya we already discussed. And coming to the last slides, avoid all Abhishanti diet causing srodhi. This word is important. I think now you are very confident to absorb this word. What do you mean by Abhishanti? Abhishanti is a very complicated word. I can tell you Abhishanti is a Abhishanti word only. Now you understood what is Abhishanti. Abhishanti means Paichilyat Gaurava Dravyam Rudhva Rasavaha Sira Datte Yad Gauravam Tasyad Abhishanti Yadhadadi. Any diet which will fill the srodhas with unwanted metabolic toxin and leading to the block, leading to clotting, leading to intra-arterial sedimentation, leading to gradual plaque formation, that is called Abhishanti. The opposite to Abhishanti is Pramadhi. Pramadhi means Nijavirena Yadravyam Srodebhyo Dosha Sanjayam Nirasyadi Pramadhisyad. So coagulant is Abhishanti, anticoagulant is Pramadhi. It is very simple understanding, no? So coagulant is Abhishanti. Abhishanti will always promote the atherosclerosis. Abhishanti will always lead to macro angiopathy. So no Abhishanti ahara in skin disease. Always think about Pramadhi. Very important, Pramadhi. And diet, then regular practice of Pramadhi, no Viruddha, no Vidahi, and no stress and strain. The last word is very important. According to Ayurveda, Rasavaha Dushti will lead to Tushti and Pushti problem. You know, actually why you are happy? Why you are happy, sir? Because your Rasa is okay. If there is no Rasa happy, your life will not be having any Rasa. It will become Virasa. I am not joking. Because the Rasa does Tushti to the body, Rasa does Pushti to the body and mind. So when you are having Rasavaha Dushti, I will tell you, you know what, how Rasavaha Dushti is happening? Guru Shidam Adisnigdam Adimatram Samastunadam Rasavahini Dushyandi Chindyanamcha. You come here. I am very happy that you completed the slogan. Very good. Give him a very good clap. Very good. Chindyanamta Adichindana. Nowadays, like that, the problem only. Everybody is thinking only. Now Trump is thinking how we will come to India. Modi is thinking about Modi. Trump will be thinking about Modi. You are thinking when Gopakumar is putting the last slide. Everybody is thinking only, no? So Chindyanamcha Adi Chindanat, that is always called stress. And the beautiful commentary told by Ayurveda with the immunity and stress is Ojachayam. You know what is Ojachayam? Ojakachiyade Koba Shuddhyana Shoga Sramadibhi. So my last concept is never ever follow a lifestyle which will be linking psycho, neuro, immuno, that is mana, oja, vata. You know the PNI axis, the very latest modern concept, psycho, neuro, immuno. What is psycho? Mind. What is neuro? Vata. What is immuno? Agni. So the old concept of psycho, neuro, immuno told by modern medicine is very well similar to our manaha, ojaha, vata. Niyanda, pranetaja, mana, vata. So when there is manodushti, vadadushti. When there is vadadushti, manodushti. When there is manodushti, ojodushti. When there is ojodushti, agnidushti. When there is agnidushti, ojodushti, immunity problem. So stress will ultimately lead to bad things in the skin. So if you want to get very good hair and very good skin, definitely no viruddha, no vidahi, no stress, and always practice pramadhi. Pramadhi means your skin will be pure. That is what you have to do. So the last word, you are getting hundreds of conditions, but you are so lucky because in Ayurveda only 3 doshas are there. Hundreds of diseases you are getting. Identify whether it is a Vata Pitta orientation, Kapha Pitta orientation, or Vata Kapha orientation. A dry, scaly, painful, fissure, hypopigmented lesion, Vatam. Last sentence. Dry, fissure, hypopigmentation, painful stages, scaling, Vadam. Readiness, temperature, oozing, pus, bleeding, Pittam. Continuous using, itching, no pain, edema, chronicity, Kapham. You will be getting a mixture of Vata Pitta Kapha only. A Vata Pitta skin disease can be treated by Grida. A Kapha Pitta can be treated by Dhara, Lebana, lastly Brahmana. And a Vata Kapha can be treated by all the treatments similar to the psoriasis, all Snehabana, etc. Whether your skin is dry, you respect Vata. Whether your skin is itching, you respect Kapha. Whether your skin is burning, respect Pitta. Soma, Surya, Anila. Soma means Kapha, Anila means Vata, Surya means Pitta. Soma, Surya, Anila in the universe, there is no itching to the universe. If there is a problem to the Soma, there will be flood, swelling. If there is a problem to the Surya, drought. If there is a problem to the Anila, Vimargamanam. So just like the entire universe is maintained normally by Soma, Surya, Anila, the vascularity, the circulation, the immunity, the mana, and the compartment of all these dosha dosha profile will make your skin very good. And that is why Ayurveda told Twaksara Vardaga is the ultimate treatment. You know, Twaksara means the real beauty inside out. Twaksara is the real beauty inside out. You cannot treat by an ointment. You cannot treat by a shampoo. You need internal shuddhi. Exactly, very good words are told. Kaya shuddhi, Kesha shuddhi. Give a good clap to him. Kaya shuddhi, Kesha shuddhi. Because no Kesha shuddhi without Kaya shuddhi. So that is why you make your body happy, then automatically your skin and hair will be healthy. That is the last word. If I am telling last word, no more slide. So healthy body is covered by healthy skin. That is what I am telling. My friend is there from Orange City, Nagpur. So that is, I am very happy to be him as my chairman. So you can see the internal orange is Shuddha, the external covering is also Shuddha. But nowadays you cannot relay. Internally orange will be damaged externally. That is not the traditional Ayurveda. So externally, internally. Externally, if it is Shuddha, Twaksara Shuddhi. Internally, it is Shuddha means Agni Shuddhi. So adopt a lifestyle which will make your internal and out, because happiness of the skin is inside out only. And you can see all the crackness, the cracks developing or the fissures developing in the Vata, Prakopa, etc. are there. And Ayurveda can make you can see. So my last concept is, whenever you are doing a treatment with Vata oil, treatment for Kapha, Chalana, treatment for Pitta, Robana and Gridabana, never start the treatment without Langhana. Even though it is Vata, never do a full oil application. No, you do Lebana and then go for Brahmana, Brahmhyastu, Murdu Lengayed. So finally, only one thing I will tell you, read Kushta Chikilsa today, read absolutely Tikta Girda today itself, and update all the yoga day by day you will be good, because any internal pathology you cannot visualize. But skin, every day you can see. Your medicine, your diet, how it is working on the skin daily. And that is why it is very easy and very difficult to same way to learn dermatology and trichology. So apply Ayurveda in a positive way. I am very much happy that all of you, I think you love your skin very much. When sir told me, sir, your topic is skin and hair, I thought that how I will talk one day with the skin and hair only. Now I am feeling that you are very much energetic, because I couldn't see any nidra in any of your eyes. Your mano, I am really telling. Wait. I am really telling, and all of you are listening. So I am very much thankful to you, because if there is no listener, there is no speaker. So whatever I told, it is only because of your Abhyantara Agni. Your Agni only removed my ama. Yesterday night, I had a little bit of disturbance because my flight was there. But your Agni enlightened my Agni, and that is why Jnana is always communicating like that only. So only one thing I will tell you, learn Ayurveda with a positive brain. Love Ayurveda with a positive attitude, and live Ayurveda, because always understanding Ayurveda will make you very light. When you are feeling Ayurveda, when you are loving Ayurveda, I told you the yogas will love you. So my humble final left ventricular advice is only one thing. Never think that Ayurveda is a complicated science. Read every day, apply the principle, read yoga, write the ingredients, what is the important contents, and then naturally will be going to the level. So I congratulate Harish sir and his entire team. I thank my chairpersons, and I thank each and every one of you. Only one thing I will tell you, the journey of Ayurveda never ends. The journey of skin disease is also like that only. So many yogas are there. When you understand skin disease in a better way, you can always go to the higher level and take Ayurveda from the hall to the public. Take Ayurveda to the public, and you apply Ayurveda in school children for their skin. You apply Ayurveda for the elderly people, for their children. You apply Ayurveda for the film star, for their beautiful skin. Thus Ayurveda can go to everywhere. Learn Ayurveda, love Ayurveda, live Ayurveda. Thank you very much. Thank you.
I think this lecture deserves standing ovation. Thank you all of you. Thank you so much, sir. सगळेजण फ्रेश झाले असतील मला वाटतं, कंटाळे म्हणल्यापेक्षा, बरोबर? एवढं एनर्जेटिक लेक्चर. सरांचा लेफ्ट वेंट्रिकलचे ॲडवाईस सगळ्या आपल्या लेफ्ट वेंट्रिकलमध्ये एक ठसा उमटवून गेले असतील, शंकाच नाही. सगळे जाऊन आज पुस्तकं उघडतील आणि आश्चर्यचकित होऊन त्याच योगांना वेगळ्या पद्धतीने बघायला लागतील, यात शंका नाही आहे. मला एकच वाक्य म्हणा वाटतं, दिस कॉन्फिडन्स कम फ्रॉम ओनली वन सेंटेन्स विच इज सेड बाय वाघभट, आयुर्वेदोपदेशेषु विधेय परमादरा. So the confidence only come when you have paramadara. So keep paramadara in your shastra. I would like to request Vaibhav Mehta sir to summarize the session in 2 minutes.
Good afternoon, everybody. Such a wonderful Medhagni Deepan before our Kayagni Deepan. I will not take much time because nothing left behind in delivering about Kaya and Kesha. Most important things which I liked and I must have to deliver, as this has been great honor to be a chairperson in front of Gopakumar sir and in front of all of you. Some of the things which I just need to mention, that Ayurveda is not magical, it is logical, very important. So logical thinking is very important. Learn Ayurveda, especially this Kaya Ayurveda and Kesh Ayurveda in a modern way, about all the symptomatology, which is macule, papule, pustule, scales, crust. Learn in the modern way, but try to treat it only in Ayurveda way, because we are having ocean of yogas available, and as sir has mentioned, love the yoga, it will heal the disease. There is one fantastic movie called as Fantastic Voyage. In that, the person goes inside the body and sees every part of your body, what is happening. I always tell to my students, you should give Reiki to your drug, to your medicine, and medicine should reach to the receptor. Likewise, love your yoga, it will reach to its destination, to its receptor. That is very important. I will just briefly mention, in cases of skin diseases, there is very high chance of getting misdiagnosis. You should use the modern investigations and parameters for the prognosis of the disease, which is very important. Most of the times, the Udarda, Shita Pitta and Kotha is likely to get mistaken, especially in a very serious illness like SLE. Patient presents with Shita Pitta but is not of Shita Pitta. And patient never goes for ANA blood test and he is misdiagnosed for Shita Pitta Udarda, the recurrence is going on. So when the patient comes to with the chronic illness of Shita Pitta Udarda coat, the patient should not be this such kind of case. So as sir has rightly mentioned in the beginning, you can make the diagnosis of skin disease in so many ways. It can be Kushtha, Visarpa, Vidradi, Shvitra, Raktapitta, Vata Vyadhi as well, like a Raktavruta Vata. So it can be just Kushtha, it can be something else. So there is one very popular sentence, if the patient don't respond to treatment, don't change the treatment, change the diagnosis. Your treatment may get changed. That is very important. Most lovely concept, sir. I will say that this is the day for me. Anulomana. Anulomana is not just Krutva Pakam Malana Dhitva Bandham Adonayet.
भूक लागली असेल तरी टाळ्या वाजवल्या पाहिजे. आपल्या या सेशनसाठी जे चेअरपर्सन्स होते वैभव मेहता सर आणि इंडे सर, या दोघांचाही सत्कार मंदार सरांच्या हस्ते व्हावा अशी माझी इच्छा आहे. मंदार सरांनी कृपया मंचावरती यावं. म्हणजे मागचा सेशन ज्यांनी गाजवला होता ते वैभव मेहता सर, ते आपले यावेळेसचे चेअरपर्सन होते, त्यांचाही सत्कार. आणि सरांचे मित्र इंडे सर. त्यानंतर गोपाकुमार सरांचा परिचय ज्यांनी करून दिला त्या डॉक्टर रश्मी दंडे मॅडम यांना मी आमंत्रित करतो. त्यांचाही आपण सन्मान करणार आहोत. रश्मी दंडे मॅडम, मी गोपाकुमार सर आणि हरीश पाटणकर सरांना विनंती करतो की त्यांनी रश्मी दंडे मॅमना फेलिसिटेट करावं. वैद्य हरीश पाटणकर सर 2 मिनिट मनोगत व्यक्त करतील.
मनोगत नाही आहे, मनातल्या भावना आहेत. इट्स नॉट अबाउट इट्स फ्रॉम लेफ्ट वेंट्रिकल. ओके, सो सर आय वॉन्ट टू डेडिकेट वन सॉन्ग फॉर यू विच इज इन मराठी, बट आय थिंक यू विल my left ventricle will connect your left ventricle with this song, sir. Okay, after this session we all will enjoy the food. We have a 30 minutes, we have a very nice time planning, so don't worry. After the food also there are very eminent speaker. Dr. Sham sir is here from Dubai. Before that the Milin Jani sir will take you excellent work. Okay, and after that some, as usual, there are too many surprises in our program, so you will find those surprises. Thank you very much. Song please. Why this song? Because whenever I saw the movie Katar Kaljat Ghusli, I think you know all. Yes, and whenever I saw the person, I feel he is this. आयुर्वेद में इतना निरागस सुर मैंने आज तक नहीं देखा था. Are you agree with me? So can we do again standing ovation with this?
दोन आयुर्वेदिक वैद्यांची अशी गळाभेट बघितल्यावर नक्कीच डोळ्यातनं पाणी येतं. आता आपण जेवणाचा आनंद घेऊया. आणि अर्ध्या तासामध्ये सगळ्यांनी इथं या. खूप छान पुढचे सेशन वेटिंगला आहेत.